Commissioner Friend.
Here.
Commissioner Morgan. Here. Commissioner Rogers. Here. Madam Chair.
Present. Item 1, approval of the minutes of the Board of Corrections meeting held Tuesday, June 15th, 2021. Is there a motion to approve? Motion by Commissioner Rogers, seconded by Commissioner Morgan. Any questions or comments? Please vote.
Motion passes 6-0.
Next is citizen comments. Anyone wishing to speak to the Board of Corrections about an item not on the agenda, please come forward. Seeing none, we will move to our report from our Director of Corrections. Good morning.
Good morning, Commissioners. Mike Myers, Director of Corrections for Douglas County. You should all have a copy of the board report for June. Turning into enclosure number 1, administrative services. We finished the previous fiscal year, $52,582 under budget. We were also able to set aside other unspent funds from that fiscal year to apply to ongoing projects during the current fiscal year to offset upcoming costs. There was $330,260 spent on overtime costs during June. As expected, this reversed a trend of 5 consecutive months of decreases. We have experienced some higher attrition of our staff recently, and we typically often have an increase in overtime during the summer months due to the number of staff that are using vacation leave. We also have an increased number of renovation projects requiring additional staffing going on at the moment as we utilize the remainder of the public safety bond funds. Enclosure number 2, community corrections and reentry services. Due to the drastic impact of COVID-19 on community corrections activities, our data is significantly different from the norm. You guys have heard me open this portion of my report with that same statement. For well over a year, and this will be the last time that you hear me say that, as we have successfully resumed all of our operations in those areas. Our work release and reentry assistance programs were closed for the month of June, but were scheduled to reopen on July 12th, and in fact, they have. Programming will begin at the CJC in late July. Actually, next week, we will bring back our contracted and volunteer programs to community corrections. Full programming for the therapeutic communities in the jail resumed over the course of June. The new security system is operational in the CJC, which has allowed us to open the facility as scheduled. The 24/7 sobriety program is now back fully to pre-pandemic protocols. There are 53 individuals placed on the program, and I'll not include it in my report, but that program continues to be used at all-time high levels with well over 400 people participating per day. There are 3,009 in-person breath tests conducted. There were 9 positive for alcohol use. There were 15 no-shows, and the overall compliance rate was 99.3%. And there were 67 individuals monitored for 1,734 days of SCRAM monitoring. There were 0 no-shows, 2 tampering violations, and 3 alcohol violations. The SCRAM compliance rate was 99.9%. There were 824 saliva drug tests administered with 86 violations. There were 32 drug testing patches submitted for testing with 11 violations. As I mentioned, work release was closed for the month. House arrest admitted 93 individuals. The reentry assistance program was also closed in June. And for reentry services and therapeutic communities, the bulk of programming for reentry services also resumed over the course of the month. Pretrial Services continues to provide regular information to the courts regarding candidates for bond reduction and early pleas in response to the pandemic. 33 individuals were referred for priority prosecution, saving 144 bed days. 337 individuals were placed on pretrial release. Overall, in the course of the month, there were 1,355 individuals managed on pretrial release with a 95% compliance rate. The law library reopened on June 7th. We continue to participate in a year-long pilot project to implement the public safety assessment as a part of our strategy to enhance pretrial release supervision and supportive services. And we are continuing to work on implementation of a pretrial case management software system, which will play a key role in our pretrial release enhancements planned throughout 2021. Enclosure number 3, compliance. Our regular documentation is being collected for all compliance processes. Preparations for the National Commission on Correctional Healthcare, or NCCHC, audit are underway. That audit of our medical services at the jail will be completed on July 26th and 27th. Enclosure number 4, personnel. 16 officers below the rank of sergeant left employment in June. These departures included 5 staff who, for various reasons, did not complete the training academy. Other departures were associated with our shift change, and a few were hired by other law enforcement agencies, so we did not have a good month for retention. 12 officers graduated from the training academy on July 9th. We are refocusing our attention on staff retention and resiliency efforts which were hampered during the course of the pandemic and other challenges that we have faced over the past 18 months. We are also working closely with the leadership of the Fraternal Order of Police Lodge 8 to implement practices to appeal to our multi-generational workforce. Turning to enclosure number 5, population. There were 1,365 admissions, which is a modest increase from the previous month. There were 1,412 releases. The high count was 1,216. The low count was 1,145. We had an average daily population of 1,171. That was an increase of 26 from the previous month. That is pretty consistent with what you'd expect over the summer months to have an increase. And actually, we're in a lot better shape than we have been in previous non-pandemic years with our population at this point. There were 80 custodial sanctioned bed days. That is a decrease. The U.S. Marshal population increased slightly. The ICE population remains stable. The felony pretrial population increased. The misdemeanor pretrial population increased. Probation violations remained stable. The female population decreased slightly, but we still were forced to operate 4 female housing units throughout the month. Enclosure number 6, medical. There were 1,100 intake screenings. There were 374 health and physical assessments. Inmates were sent out 17 times for emergent medical care. 5 of those were by 911. There were 2 hospital admissions, which resulted in 3 days of combined hospitalization. Enclosure number 7, mental health. There were 114 initial psychiatric appointments. There were 108 initial mental health assessments. There were 63 mental health infirmary placements, which primarily are those individuals who are on suicide watch. There was 1 referral to a board of mental health and 1 placement in long-term psychiatric facilities. And our other noteworthy items, we continue to respond to the COVID-19 pandemic. We did have 2 individuals who were confirmed to have COVID-19 in the jail during June. However, both of those individuals were positive prior to booking. We were able to successfully isolate them and prevent spread within the facility. Approximately 75% of our staff have been vaccinated, and as of July 1st, we had vaccinated 859 incarcerated individuals, including 115 during the month of June. And we have been really pushing the vaccine process even harder during July, so I think we'll see those numbers increase again. We continue to follow CDC guidance for correctional facilities. We are consulting closely with the Douglas County Health Department regarding resumption of several operations that were suspended or modified during the pandemic. In June, we initiated the following. Vaccinated program contractors and volunteers began to provide in-person services at the Department of Corrections. On June 1st, we began in-person attorney visits for the review of discovery materials and other documents. On June 7th, we reopened the law library with safety protocols. On June 14th, the bulk of contracted programming for reentry services resumed. And scheduled for July, some of these dates have already come and gone. A core group of volunteers will be allowed to resume in-person services in the jail. Now, on July 12th, a little over a week ago, work release and the reentry assistance programs did in fact open. And July 26th, next Monday, programming will resume in community corrections. We currently do not have a timetable set for the resumption of opening the lobby to the public for on-site visitation, and that's due to the utilization of space for our attorney visits for virtual court. We have to figure out another plan on how to co-locate those activities because we would force all the attorneys up to that same area if we resumed public visitation in our lobby. Work to implement our body-worn cameras, our new security system and tablet system continue. Several staff development, wellness, and resiliency efforts are being developed to include, but not limited to, establishing teams of trained officers who will respond as peer support specialists to their fellow officers in times of crisis, developing spaces in the jail for staff to decompress and recover after traumatic events, engaging in increased team building and staff appreciation activities to build camaraderie and trust among our staff. One big thing that people tell us about all the time is developing healthier food options within the facility. We are offering training to help develop increased coping skills, and we're working with our bargaining units to implement alternative work schedules. Finally, the correctional profession as a whole is realizing that we must do all we can reasonably do to counteract the toll that this line of work takes on the body, mind, and spirit of those who work in it. And I am making a recommitment to our staff that while we cannot eliminate the challenges they face every day, we can make a comprehensive effort to counteract the negative impact of those challenges. Not only is the goal to have a healthier and more skilled workforce, we hope to improve retention, which will drive down hiring and training costs associated with constant hiring and training of new officers. And with that, I am ready for any questions.
Commissioner Friend?
Thank you, Madam Chair. Mike, thanks for the report again. The last few bullet points that you lay out in your presentation normally every time you do it always beg the question to me. I mean, do we have a, if you were sitting on this board, what would you like to tell the other you standing there that could help with these type of things at the end? Because we continually move down this road where we're talking about mental health, and I've never worked in this environment, Mike, and I guess I'd like to know things that you think we should be made aware of in regard to some of these final bullet points that you laid out.
Sure.
Are we missing something? Can we help? If you had a wish list of 3 things, can we help with them right now?
You know, I don't know that I have, well, we're going to be pursuing, like I said, working within our budget that's to develop some kind of quiet spaces for people after traumatic events. That's something that is becoming pretty common in jails, newly constructed jails around the country, and we're working to kind of retrofit what we have. A lot of jails are being built with staff retention in mind, access to outdoor spaces, courtyards, et cetera. Now, we have some limitations with our physical plant that won't necessarily allow us to do that, but we're going to make every effort to replicate those environments as closely as we can. You know, this is a tough job that our staff get into, and you know, I go back to 2 years ago, I was having a lot of talks with this board about our staffing levels and our morale, and we really made what I felt up until the time that the pandemic began, we made a significant amount of progress. Our staffing levels came up. Generally, people seemed more pleased or more satisfied with their work. Our attrition rate started to decrease. And even throughout the first several months of the pandemic, there was really more kind of a coming together of realizing the challenges that we had, and there was really a lot of bonding through that. And some of those original efforts, we had a staff wellness committee, we had a strategic plan that was focused on helping our staff be more healthy. A lot of those things just took a back seat during most of the pandemic. And I think what we're seeing now in large part is just the long-term impact of the past 18 months that's had on some of our staff. And, you know, so they need to see something, first and foremost for me as their director, that, hey, we're done, well, we're not done dealing with the pandemic, but we're recommitting our focus to you and your wellness and your satisfaction and working with them so that they can see that we are going to be putting some things in place to help counteract some of the negative things that they deal with every day, because it has a cumulative effect on folks over the course of time. So to answer your question, Commissioner, I'm not sure if I have a wish list per se. We're doing a lot of investigation and brainstorming with our staff right now to try to, I may ask me that question in a month and I might have a different answer for you.
Okay, thanks, Mike.
Commissioner Kavanaugh?
Thank you. And thanks for this excellent report. I want to congratulate you on bringing in your department under budget. Kudos. There aren't a lot of departments that can say that, and it's been a tough year all around. So doing that, I think, deserves 2 thumbs up from all of us. So congrats on that. The report, I think, is just getting better and better in terms of clarity and our ability to see the important stuff. So I'm just going to touch on a few things here that, you know, are kind of standard metrics that we talk about. Your authorized personnel is 479 FTEs, and you have on hand 447, or 93.3%. You know, that's something I know you've struggled with, but the charts that you have there, I think it's on page 7, show a steady progress in terms of our incoming classes over the last couple of years, and that makes a huge difference in terms of staffing, overtime. So kudos to that. We'll get back to that in a second. But the average daily population on page 31 at 1171 is standard for this time of year, up, down?
I would say generally, Commissioner, that's a little down. Take 2020 out of the equation because everything was different.
Let me just comment here. It seems to me that August is usually kind of our high point month.
That's correct. And it was 2 years ago about now that I reached out to law enforcement and the courts because our population was nearing 1,400. And that was with community corrections fully open, and people there as well. So we were in a very tight spot at that point. So, all in all, the makeup of our population is more challenging. There's more maximum security inmates. It seems like the challenges of dealing with those with mental illness keeps getting more and more taxing.
Let me just.
But the numbers are down.
Right. Let me just, on that particular point, because on page 38, you give us the race breakout of the population, which we've come back to every month, and it concerns me because on page 38, the population shows, again, a massive minority majority of 64.24%, I believe. And I appreciate the kind of the change in the graph. It's easier to comprehend that way. I'm a little color challenged, and so if we could make the colors not all
Different,
orange,
right.
that would be just a minor.
I asked that they be lightened.
No.
So now I see that they're all the same color.
You're vastly improved over when we first started off of this, so thank you for that. But it's a concern, as well as the mental health component, and hopefully, we're having discussions now about the American Rescue Plan monies that we have coming in, and maybe we can do something to combat the admixture of people who are demonstrably mentally disturbed with the overall population. And there's a lot of people in there who, they've got something filed against them in criminal court, but they have mental problems that this is just a manifestation of that. And having that distinction made, I think, is going to be better all around. You said the COVID report showed 2 positive in-population people, 75% of the staff vaccinated. No staff positive tests?
No, we're grateful that we have not had a positive staff case for the last several months.
Okay.
And like I said, these 2 that were positive before they came into the facility.
1 minute.
Right. We'll come back to this because there's a few other items, but we're going to hear our new health department directors here to give the first report, and we'll be talking about stepping up our vaccination policy. I mean, Douglas County, we're doing okay. We're over 50%, but we got to get this thing taken care of. And the only way that we're going to get out of the COVID pandemic is through massive vaccination. So we'll come back to that. You said there was still some ongoing public safety bond projects that you were dealing with. Real briefly, what are those?
So the original scope of the project has been completed. There was leftover funds. We're doing some renovations to showers, and then there was a couple of other kitchen-related projects and an elevator repair that we were able to squeeze in under the deadline.
That's great. The whole thing came in on time, under budget, and you've got extra funds to do some more stuff. That's really kudos. I'm going to come back in my second opportunity with a couple other questions. Thank you.
Time. Let's see. Commissioner Maureen Boyle.
Thanks again, Mike, for a great presentation. Just looking at the numbers again, I noticed that it says there were like 1,365 admissions, and then what I also noted was that 984 people were diagnosed with mental illness. Do I have those numbers correct?
So that's a cumulative total over the course of the month. So that's a little deceiving. There is another graph towards the end of the report, which should.
I guess I'm just looking for a general idea about how many folks that present to corrections are diagnosed with a mental illness, and more than anything, that just solidifies the fact that we really need to work on that as a county.
So if you turn to the graph that looks like this pyramid,
Yeah.
that gives you the cumulative totals, which will give you the accurate percentages. So you see that we were at 42.41% of individuals were diagnosed with a mental illness. Over the course of June, with people coming and going, there were 2,320 individuals who are in our custody for at least 1 day. And of those, 984 were diagnosed with mental illness.
So really, when you state here the last thing you said, 42% of folks who come through the doors really are diagnosed with some type of mental illness.
Correct. And about half of those are with serious mental illnesses such
Okay.
as schizophrenia.
Okay, you're just providing really good points for us to put our efforts to use American Rescue Plan funds towards mental health, that's for sure. So more than anything, I just want to make a point with that. The other question I have for you is as you know, this pandemic is getting pretty scary again, and I kind of I like what President Biden said, where this is becoming a pandemic of the unvaccinated. So really, our efforts really have to be pushed towards those who are not vaccinated. You mentioned that you're trying to get those who work with you who are not vaccinated, get them to get vaccinated. Can you describe strategies that you're using to do that? Because what I find is in my medical practice, it's really hard to get folks to turn the corner on it.
Yeah, so for the incarcerated population in particular, they're getting education every day. Dr. O'Keefe at the Douglas County Health Department did a town hall with us towards the end of March, and that's been being replayed on our programming TVs every day to dispel any misconceptions about vaccines, to provide all the information, the benefits, the risks, et cetera. It's about an hour-long town hall that replays 2 or 3 times each day. We also are offering incentives to our inmate population to get vaccinated in terms of they can reduce or eliminate their quarantine periods, opportunities to be in different programs. Those are all sorts of incentives that we're offering them. And we're still working through a lot of the plans. I've already demonstrated my level of neediness to the new health department director, and I'm grateful for the time that she's already given on my department. But we continue to, and we'll make another push with our staff once again. I mean, they've gotten all the education, all of the pushing and prodding, and we've kind of backed off that a little bit because we were kind of, just at the point where, it's really everybody who was going to do it, it seemed like they were going to do it, that they've done it. But we'll make another push given the fact that, there are some things changing in the community going in a little bit in the wrong direction again. And it's only a matter of time. We are a reflection of what happens in the community, and it's only a matter of time until we have that impact at the department again.
All right, thank you.
Commissioner Kavanaugh?
Thank you. Thank you. Following up on what Dr. Boyle was just asking you regarding our staff, 75% is a good number, but not a perfect number, and we want to get to as close to perfect as we can on this. So we have, I think, the opportunity maybe to go in and talk to some of these people, incentivize them to become vaccinated and possibly require. And maybe we should talk in executive session. I've had some discussions with our county attorney relative to our ability to require employees to become vaccinated, particularly who are in frontline types of positions, our healthcare employees, our corrections employees. I just put that out there because we're going to be talking some more about getting vaccinations as widely distributed in our population as possible. So just FYI. You mentioned that you're working with the FOP 8 to appeal to the multi-generational workforce. Could you expand on that just real briefly?
I can. During our last contract negotiations, we separately approved an MOU to do a pilot for 10 or 12-hour shifts. With the onset of the pandemic and that discussion really hasn't materialized since then. We're now starting to engage them on beginning that process. Basically, we're shooting for a sweet spot where we don't negatively impact anybody who's earned the seniority over time to have the shifts and days off that they want, but offering this opportunity to enough people who are maybe newer into our profession who may find the 12-hour shift, the rotating days off, to be more appealing and get them to stick with it through those initial years of employment.
That's great, because I think one of the difficulties we've had, and this goes to retention as well, is people having to do required overtime, and they have, families and obligations like everybody else, and particularly in the corrections business, which is an extremely stressful job. I mean, this isn't like, being a night watchman. This is really hands-on, and so 12 hours in corrections is way more than most people could probably handle on any kind of a regular basis. That's great. You also mentioned team building initiatives. Could you tell us a little bit about that?
Yeah, for instance, next week there's an event called the Jailhouse Olympics, where there are teams throughout the jail engaging in competitions related to activities they do every day. Who can find the most items on somebody on a staff member. We're not using anybody who's incarcerated in these competitions, but who can find the most items hidden on somebody on a pad search, who can, things, use, how quickly can you get somebody who's mildly resistant, fully restrained, different kind of fun activities. We're gonna try and be repeating some of those things, different activities off and on to kind of, it's a pretty, jail by its nature is never gonna be one of those places like, that has, ping pong and coffee shops, in the workplace like a lot of places do now. So whatever efforts we can make to lighten people's moods, we're going to try and do that from time to time.
That's really cool. And as you can see, I'm a big Olympics fan. And so maybe you could keep us posted on that. Are there, like in the Olympics, are there prizes, awards?
There are. They will get medals. They will have they got to choose their own national anthem, so to speak, for their own team. So that song will be played over the intercom when they're awarded
1 minute.
When if they've won that particular event. That's great. I think those initiatives really pay off in terms of retention, and the graph that we referenced before relative to how our authorized personnel, we're getting close to that number. A big part of that is what you're doing, I think, and again, kudos for that. That's going to pay off long-term, both in reducing overtime and I think retaining qualified personnel. So thanks for all of that. Thanks for the great job you're doing.
Thank you, Commissioners.
Mike, could you maybe, and I would ask Chair Friend, who chairs this committee, the Corrections Committee for us, if you could put together a presentation either at the next Board of Corrections meeting or maybe just at one of your committee meetings on and work with Commissioner Rogers because he's been instrumental in this effort on the pretrial stuff. And it's, kind of give us a pretrial 101.
Where we're at, where we're going.
Yes.
Okay.
Because I know we've talked about it for a long time, and we just really haven't gotten a real good feel for where we are with it. And
Absolutely.
then what this board potentially would need to do to support those efforts being either sped up or completed more timely, so.
Absolutely.
Okay.
Sure.
Thanks. All right, thank you.
Thank you.
All right, we do not have need for an executive session on this. Please note, though, that we will be touring the facility after our county board meeting. Is there a motion to adjourn? Motion by Commissioner Rogers, seconded by Commissioner Morgan. Please vote.
Motion passes 6-0.
We'll move to the agenda for the Douglas County Board of Commissioners. Roll call, please.
Commissioner Marine Boyle?
Here.
Commissioner Mike Boyle is absent. Commissioner Kavanaugh? Commissioner Friend?
Here.
Commissioner Morgan? Commissioner Rogers? Madam Chair.
Present. Item A, approval of the minutes of the Board of Commissioners meeting held Tuesday, June 29, 2021. And item B, approval of claims submitted for payment processed through Tuesday, July 20th, 2021. Is there a motion to approve? Motion by Commissioner Rogers, seconded by Commissioner Maureen Boyle. Any questions or comments? Please vote.
Motion passes 6-0.
We have a consent agenda with items A through N, but please note A has been removed. Also, it has been brought to my attention on item H3. They're in the resolution, they are requesting that the last line of that resolution be stricken. So it says it is estimated that the cost of this project will be approximately $360,000, and the Sanitary and Improvement District number 603 shall pay 100% of these costs. That's being stricken. Correct?
Yep, Dan Ash, County Clerk. So that is, I think it's just a copy and paste error from item 2. Item 2 does involve that sanitary improvement district. Item 3 is not. It's a completely different item, so they just forgot to remove that last sentence from, so that's why it's being requested to remove that last sentence from, specifically from 3, not from 2. That will still be there in item 2, but item 3 is a different scenario.
All right. Are there any other questions or comments on the consent agenda? Commissioner, is there a motion to approve first? Or does anything want to be removed? Any items removed? All right, there's a motion by Commissioner Maureen Boyle. Is there a second? Second. Commissioner Kavanaugh?
Just to clarify on H, if I understood the clerk correctly, H2 has the language relative to payment of the expenses?
Yeah, so item 2 is the interlocal agreement between SID 603 and Douglas County.
Right.
And so item 3 is actually regarding a
Completely
different
different
interlocal
item.
agreement, and it just,
And the payment. So it was kind of a typo in item 3 to have.
exactly, yeah.
Okay.
Yeah, that sentence has nothing to do with item 3, so they want it removed.
But it is in item 2, which is the item regarding
Sure.
the traffic.
Yep.
Okay, yep.
I have one other question, and
Uh-huh.
this is something that's just for the public's edification. We are approving the purchase of Douglas County liability insurance in the amount of $1.4 million plus. And I'd just like our finance director, oh, Daryl, there you are. We touched on this yesterday in our pre-board meeting, and I was just, trying to explain to folks out there, because it's a kind of a significant amount of money. What are we doing here in terms of insurance? The county is largely self-insured, and so there's extra insurance that we do. Could you give us a brief outline of what this is?
Daryl Neely, Douglas County. The county carries high retentions and is self-insured in workers' compensation. But we have a variety of coverages, liabilities, property, to address the risks of the county. And so we're renewing, as we've done in the past. An annual renewal comes due at this time of year. So that's the purpose of it. If you have a specific question.
So these extra policies that we have, could you give us a brief categorization of what they are for?
Sure. For example, we have a property coverage policy, which would cover property damage to buildings and that type of thing. We have a liability policy, which would cover us in the event of an auto accident and an injury to another party. And we actually have 2 liability policies. One of them addresses professional liability at the health center. And the reason for the 2 policies is the risks are much different. So a carrier is not going to do the whole blanket. So we have 2 carriers in that situation. We have an excess work comp policy, which in the event a comp claim reaches a certain point is then transferred to the carrier, kind of a stop loss, if you want to use those phrases. We have a fiduciary policy, which addresses the pension plan. Public defender's policy, which would cover any failures on the part of the public defender. Crime policy, which would address theft by county employees. And then there's 2 umbrella policies attached to the general liability policies. One for the core county, and then one for the health center.
And our finance director indicated yesterday that we're kind of in a hard market relative to insurance costs. They've gone up, premiums have gone up, so the cost of these policies has gone up. But we did not go out for bids this year, but it looks like we may next year. Does that sound right?
Well, when you say bids, we have an agent and we have a broker.
Right.
And they do canvass
minute.
the companies out there.
Right.
And so it is, if you use that term, marketed. I mean, we're not married to any of these guys. So they are out kicking the brush.
Getting us the best deal.
That's correct.
That's very good. Thanks for that explanation.
Okay. Other questions?
No.
Thank you.
Thank you. Any other questions on the consent agenda? Seeing none, please vote.
Motion passes 6-0.
Next, we'll move to recognition and proclamations. We will be acknowledging Deputy Timothy McCoy for his retirement after 22.6 years of service at the Douglas County Sheriff's Office. I don't believe they're here today, but we do wish him well on his retirement and thank him for his service to Douglas County. Is there a motion to approve?
Motion. Second.
Motion by Commissioner Morgan, seconded by Commissioner Friend. Please vote.
Motion passes 6-0.
Citizen comments. Is there anyone here wishing to speak to the Board of Commissioners about an item not on the agenda? Please come forward.
Good morning. Larry Storr, 5015 Lafayette Avenue, Omaha, Nebraska, 68132. Today I'm presenting some testimony, sixth in a series, having to do mostly with public meetings, Open Meetings Act. I've recently been to a number of different bodies' meetings, and they all are different. The rules are all different. Some have some rules, some don't have any rules. I was at the Learning Community Council meeting, coordinating council meeting. Now, the reason I'm bringing that up is because they get county tax money, or they disperse county tax money. That body put the items for citizens' comments, if any at all, at the very start of the meeting, so that they did, citizens that did attend, and there were a lot of citizens. It was a very divisive meeting because the basic reason they were there was a topic called critical race theory, which is denied by everybody. Nobody does it. Nobody teaches it, but it's all over the map. And it's discussed by an awful lot of people that you politicians don't want to admit to, or maybe you're too busy to know it. But it's a USA-wide problem. There was a group there, and it's some of the same people that we've had in this council meeting, board meeting, and in the city council meeting. This group are members of a Marxist organization. They wore their black berets. They had their fists in the air, and now they have the T-shirt that says Revolutionary Action Party, and now they've changed it to just RAP. They're the same people. They're all affiliated with Antifa, Marxist Party, the BLM, and now the Revolutionary Action Party. Politicians in Omaha don't want to talk about this, but they'd better. I was, I believe, removed from a meeting a few months ago for referring to a revolution going on. Commissioner Boyle called me out about it, said I was being untruthful, and we will not have that discussion or that word in this council meeting, this board meeting. At the Learning Community Council meeting, the attendees, the speakers, and the other attendees were allowed to yell and shout, intimidate, in fact, yell at me to take my hat off. Public meeting, They wear their Marxist berets, but they order me to take my hat off? The citizens, some of them sitting on the floor so the cameras wouldn't see them, but raising their hands, telling me to take my hat off? Excuse me? Not one coordinating council member called anybody out of order. Yes, they did call me out of order for speaking a little bit over because I was interrupted. These meetings need to be more consistent. They all subject to the Open Meetings Act, which isn't necessarily for the politicians, not necessarily for that body. The rules should be consistent, the procedures should be consistent, and the basic thing here is they're not for you. These meetings are for the citizens of this country and this state and this county and this city to come and petition their government. But we're not allowed to back and forth unless you invite me to. I don't think that's the spirit of the Open Meetings Act or the Constitution of the United States. Running out of time here, but our local news media don't report on it,
1 minute.
but all the local newspapers around here do. The independent newspapers, it's all over. Revolution, revolution. This is my last of the six. Maybe not my total last, but I do intend to write a letter to the Douglas County Attorney and the Nebraska Attorney General asking them to enforce the Open Meetings Act so that it is consistent between bodies. We have bodies that are trying to eliminate citizen councils altogether. Now, a city council in Fremont has open comments for citizens, but here they do not. And they're trying to eliminate that out of their agenda item. The politicians are running them up with the power. You don't have the power unless we give it to you, but you've taken it from us. Thank you.
Anyone else wishing to speak to the Board of Commissioners about an item not on the agenda? Seeing none, we will move to our presentations. Our first is our COVID-19 update and COVID-19 vaccination plan. And today it is presented by our new Douglas County Health Director, Dr. Lindsay Hughes. We welcome you to the Board of Commissioners and welcome you to Douglas County.
Good morning, Madam Chairman and Commissioners. Thank you for that warm welcome. It's wonderful to be here in Omaha. I'm Lindsay Hughes, the Director for Douglas County Health Department, here to give you an update this morning on COVID-19 and vaccination efforts in Douglas County. So I apologize for my somewhat rudimentary presentation this morning. This is trying it out for the first time, and I can certainly gear this up to be a little more complex if you prefer in coming weeks, or dial it down if you want something even more simple. So to start out with, I thought I would cover where we're at with COVID-19 cases here in our community. As of yesterday, we were sitting at 6.5 cases per 100,000, and that is a 170% increase from where we were a month ago. So on 6/19, we were sitting at 2.4 cases per 100,000. So as you can see, that's a fairly significant increase in cases that we've seen across Douglas County. Currently, our hospital beds are 73% full. That's about stable for what we've seen over the past month. So we haven't seen a huge increase in hospitalization rates. We may have seen a little bit of an increase and then a little bit of a decrease from day to day, but overall it's been pretty consistent. ICU beds are about 65% full, and again, that's been fairly consistent over the past few weeks. Currently, we're at 736 deaths. Currently, we've been seeing about 1 to 2 a week. That has, of course, slowed significantly from where we were earlier in the year, and we're very grateful for that. We would love to see that number stop. We would much rather see 0 deaths, but it has seemed to slow, so that's good news. Another trend that we're seeing right now is the increase in positivity rate. So back in June, we were at 6% of the tests that we were doing were coming back positive for COVID-19. Currently, 14.7% of the cases that we are sending, or the tests that we're sending out, are coming back positive for COVID-19. So we know that more of the tests are positive. That makes sense if we're seeing a lot more circulation of the virus in our community. I feel like this is second grade with my little overhead projector. Okay, this is a question on everybody's minds about Delta. So the Delta variant right now is our predominant variant that we are seeing. I want to be very specific when we talk about this, though, that we do not sequence every single test that goes out. So when we say sequence, that's basically a fingerprinting process where you're looking at basically somebody's test sample and looking at the specific markers in there to see what kind of the virus it is, what family it belongs to. So as you know, the Delta variant started circulating quite heavily back in May, June timeframe. We definitely have seen, if you look at this chart, the blue is really the other variant, the B117, that was predominant prior to now, and so far it's really flipped. So the ones that we are sequencing are almost all now coming back Delta. It is a small proportion of tests that we do sequence, but they are almost all coming back as Delta now. And why that's important to know is because Delta is significantly more transmissible than the previous variants. So that means that it's much easier for it to spread through the air. It's much easier for it to spread just passing by people. Whether it makes people a lot sicker is still kind of up in the air. Some studies say absolutely it does make people a lot sicker. Other studies have found that it is about the same, so the jury is still out on that. I think it's safe to say it's at least as bad as what we have seen previously, and so warrants definitely our attention. So we are watching that very closely. There have been other variants that have started showing up nationally and globally, and of course we're keeping our eye on those as well. We're not seeing those here yet necessarily, but we will continue to send tests for sequencing, and if we do see anything else that comes up in the community, we will definitely let the public know about that. But right now, predominantly Delta is what we're seeing. Vaccination is a huge effort that we are still continuing at the health department. Right now, for our over 16 population, 69.3% have had one dose, which is great news. 65%, almost 66% are fully vaccinated in our over 16 population. For over 18, including federal data, and I'll explain that here in just a moment, over 71% have had one dose and 67.8% are fully vaccinated, which is excellent news. Why we have this little disclaimer on there saying also federal data, people who are vaccinated through federal systems, so some correctional facilities, Indian Health Service, the Veterans Administration, the Department of Defense, all report their vaccinations through a different system than what we can see on a day-to-day basis. So it's just tracked a little bit differently. They're still in our community though, so they're still a very important number to track because they still contribute to either protection or transmission in our community. So it's still important for us to make sure that we're looking at that. So we are able to get that data, it's just not as consistent and reported in the same formats necessarily that we look at. However, in aggregate, we can look at that information. So basically that over 18 group is what we have that data for. So that's why we have that reported up there. I'm sure a lot of people are interested to know why we don't have data necessarily going down below 16 years. We do, it's just not very good data. So what happens is the denominator data that we have actually includes all of those kiddos that are under age 12. So your denominator data is including people who are not even eligible for vaccination. So that really kind of skews your picture a bit. So we can report on that, it's just not very accurate. A little bit on what we're currently doing. So in terms of vaccinations, we are doing everything possible to be out in the community and be out where people are to get this vaccine to them. We've been to schools, we've been to faith-based organizations and churches. We're currently doing pop-up clinics. To date, we've done over 90 pop-up clinics. And what we mean by pop-up clinics is it's literally a pop-up clinic. We drive our vans out and stand up a clinic wherever somebody has requested us to go. We are also trying to get motion on physician-based clinics because we know that some people who experience hesitancy really want to hear about the vaccine from their own personal provider. That seems to be something that's borne out in the literature, that some of our hesitancy, certainly not all, is something that can be assuaged through our physicians, so we're working with them now. And then we are still having vaccine walk-in clinics at our facility at 41st and Pacific on Fridays, where people are able to just walk in on site at the health department and get their COVID vaccine that way. Testing is also something that we are promoting. We don't do it on site through the health department. Test Nebraska, as you probably are well aware, has gone away. That was a huge avenue for people to get free testing. We are working closely with partners in the community, so FQHCs, hospital systems, providers, pharmacies, really to find out who is providing testing and who's taking certain types of insurance, and where we might be able to get free testing set up for those who can't afford testing, and then also providing that information for locations on our website so that the public is able to basically find those tests as needed. One of the more important things that we're doing is really just being extremely transparent and open with as much information as we possibly can be with the public regarding our efforts and what's happening with the virus. So we recently put out guidelines to the school districts about recommendations for how to prevent COVID transmission going forward this year. We've done a number of media interviews, which I'm sure will continue. We're still continuing to do daily press releases that includes numbers of vaccinations given, numbers of cases, information such as that. And we are still displaying our COVID dashboard on the Douglas County Health Department website. So if anyone in the public is interested and wants to know basically in real time where we're at with a certain metric, they're able to go to the website and find that information for themselves. So we are doing a number of things to continue to push these efforts forward. The situation, of course, is ever changing, so we are keeping our eye on that and are ready to flex to whatever those demands might be. And with that, I'd be happy to take any questions you might have.
Thank you very much, Doctor. Commissioner Kavanaugh?
Thank you. And thanks for this, Doctor, and welcome to the Douglas County family. The number that I'm looking for regarding the vaccination number, and it's on your dashboard, but I don't see it on your report, is fully vaccinated out of all Douglas County residents. So we're all swimming in the same pool here, and the number that's contained in this report, I appreciate, is people of certain subsets. But it might be helpful going forward if we have as a baseline the fully vaccinated number, which does appear on the dashboard. It's
Absolutely.
52.3%. So that we don't give people a false sense of security when we're saying, well, 69.3% or 71.70% are fully vaccinated. Actually, it's 52.3% of the population.
Right.
And this goes to your concern, our concern, everybody's concern is to get our population to that 70% plus And I know that you're making every effort that you can. A big part of these unvaccinated are younger children. And I noticed that you've got initiatives in here relative to school and faith-based organizations. How do we look at that going forward? Kids are going to be going back to school here shortly, and they're largely unvaccinated. We have a new variant, which I understand is much more easily transmitted than the original COVID-19 variant. What's your thoughts on that, relative to coordinating with the schools, school districts?
Absolutely. We actually are working with the school districts currently to be at their registrations. So we're able to offer vaccination actually as families are coming in to work on getting their kids back to school. And all of the school districts have pretty much been receptive to having us come in and assist in that way. So we are definitely working very, very closely with them to reach families where they're already going to be, trying to limit those barriers where, well, gosh, this is another thing I have to do, now I'm going to have to, if I want to get my kid vaccinated, I'm going to have to, make a trip downtown, or I'm going to have to make a trip over here. Let's make it as easy as possible. If we're right there and you're going to be going, right through anyway, let's stop and get that done. So, and that includes, we're going to have to be there more than once, obviously, because Pfizer vaccine takes 2. So we'll be back however many times it takes, however many times the schools want us to come in and do that, we'll be there to offer that.
So, touching on that, would we have the capacity to set up vaccination sites at schools for kids coming back, like registration?
Absolutely, that's what we're working on.
Okay, that'll be great. That's going to require an enormous effort. I mean, there are scores of schools, but that I think would be a great one-stop shop. And if we can focus on that population, we can really move the needle. Relative to the adult population of unvaccinated people is a kind of different kettle of fish. You heard from our corrections director that 75% of the corrections personnel are vaccinated, and we'd like to move that as quickly as possible to as close to 100% there at the Douglas County Health Center. I presume the health department has a very high percentage of vaccinated people. What are your ideas on, 2 things, incentivizing people and requiring people to be vaccinated?
Great question. So requiring people is a little tricky right now because the vaccines currently are under an emergency use authorization. So there are limitations on what you can require until a vaccine is fully approved. The Pfizer vaccine they have filed for full approval with the FDA. That is slated to happen in January, so got a little time there. They are getting priority reviews, so we may get lucky. It may happen sooner. Fingers crossed. So in terms of employers requiring vaccination, that's certainly a tactic that has worked with other things and could be useful. I don't know that we can do that just yet. That's, I think, a question for county attorneys. Right. In terms of incentives, they can work. There is a subset of the population that does respond well to incentives. They have to be dealt with very carefully from an equity standpoint. They also can backfire. So, if you're going to go down the road of using incentives, you just have to be very careful in how you're applying those.
Time.
We'll come back. Thanks.
Absolutely.
Commissioner Maureen Boyle?
So, hello. So if you wanted to say anything more about incentives, I was going to bring that up as well.
Oh, great. Okay. Really, just to finish, I think it's something that we certainly could explore if that's of interest. Again, I think it just has to be done with a lot of care. My concerns really are how that can impact disadvantaged populations and how it can appear somewhat coercive. I do have it has to be done very carefully if we're going to do it, but I do believe that they can work in certain situations.
All right, good. And then a few other questions. It seems like most of those that are affected by COVID at this point are the younger population. Do you have, and I always ask Dr. Poor this, but the hospitalized numbers, the hospitalized folks, do you know how many of those have been vaccinated, or do we have demographics on them?
I don't necessarily know how many of the hospitalized people have been unvaccinated, but I would say predominantly unvaccinated are the ones that have been hospitalized in the past month.
Okay, and then do you know if there have been any deaths in those who are vaccinated?
Not locally.
Not locally. Okay, good deal. And then just going through my list here. As far as the schools go, we talked about how important vaccinations are going to be, of course, and the efforts put forth to do that, which of course we're completely supportive of. But do you have thoughts on masking at school?
Yeah, masking is another one of those touchy ones, and it's a hard one. I will say we put out school guidance just yesterday, and that followed really the guidance that came from both DHHS and CDC kind of mixed together. And really, we are recommending that children who are unvaccinated wear masks, as the CDC does. The American Academy of Pediatrics has come out and said everybody should mask around children because we don't know whether children have had the opportunity to be vaccinated. And honestly, these are the experts in children and children's health. And I tend to feel like as children are going back into school, it is important that we consider masks as one of our tactics to use. I can't mandate that they mask, but I would certainly strongly encourage that our school districts consider for their younger populations that they're masking.
All right, and then do you, just putting on your, looking in your crystal ball, what about masking for adults as Delta becomes more prominent? What are your thoughts?
Yeah, absolutely. If our vaccination numbers don't increase, I would say that it's something to consider in the future. If we see our hospitalization rates go up, if we see our trends start to worsen, I would certainly explore it. My line over the past couple of weeks has been never say never. I won't shy away from a mask mandate or asking for some kind of a mask requirement if that is what is going to protect our public and keep people operating and living their lives.
And then just alluding to what Commissioner Kavanaugh was speaking about too, it really is important to figure out ways to, I don't want to say incentivize, but how do we get those folks that are not willing to be vaccinated, how do we get them vaccinated? Because when the vaccines first came out, many of us were tripping over ourselves and would, get in a fight in order to get our own vaccines. We in the medical profession would, take the shot. We couldn't wait for our moments to get our shot. And now we have another segment of the population that's really the complete opposite. We talk about how when people speak to their physicians, that does have an impact. I feel it does just because I've had a couple of patients ask me specifically about it.
1 minute.
But at the same time, there are some people you just can't even, I bring it up and they'll be like, nope, not even talking about it. It's like talking about quitting smoking. And so it really is a challenge. Yeah. So just as a comment, I feel like the onus really is on each of us, just not as really as even as citizens, but as friends, as coworkers, as brothers and sisters, as daughters and sons, to speak to those people that are close to us who are not vaccinated and tell them why we think it's important. Anecdotal things, stories work a lot better than saying this is the data, which is not how science works, but that's the fact. So I'm really asking all citizens out there, just do your best to get all of your family members, all of your friends vaccinated, because COVID itself is so much worse than the vaccine. And I don't care what your politics are, that's just a fact.
Well said, Commissioner Boyle. Thank you for that.
Thank you, Commissioner. Commissioner Kavanaugh?
Thank you. Just back to the statistics for a second. And we talked about maybe adding the total population vaccination statistic of 52% to the vaccination information that you give us. You indicated that cases are way up, 170%. If you broke those out, how many of those are kids? What percentage are we talking about? I mean, that tells us something about where the virus is going among the unvaccinated population. Do we break that out demographically?
We do. I'm looking at charts in my head right now. So predominantly the cases are occurring in, I would say, the 18 to 54-ish group. There are cases certainly occurring in children as well. I think that you may see a shift in that over the next month or so, month or two, as you have children who are not outside or in basically their summer settings coming back into these congregate settings. It's not surprising to see a higher rate in adults, given that they are typically in more congregate settings through work or whatever the case may be, social settings and things like that. Kids during the summertime typically are not in close quarters in large groups as they are in school, so that it very well could change.
Okay. If that's available, could we maybe going forward kind of get a breakout so that we can see where the virus is going inside the population?
Yeah.
Because it seems like we're headed for another spike here.
I'd be happy to include that.
Thank you.
All right, any other questions or comment for Dr. Hughes? Again, thank you very much and welcome.
Thank you. I look forward to serving you.
All right, thank you. Next, item B under presentations is discussion regarding the issuance by the county of its Educational Facilities Revenue Bond Series 2021A. This is a Creighton University project. And 2, Educational Facility Revenue Refunding Bond Series 2021B, Creighton University project. And this is on behalf of Creighton University to finance and refinance certain capital projects of the Creighton University. And here with us is Josh Myers from the Bond Council with Kutak Rock.
Thank you for the introduction. So Josh Meyer, Kutak Rock, 2328 North 188th Street. We have done this the past few times to hopefully make your life a little easier when there's any bond issuance where you all are acting as what we call a conduit issuer. That is, you're issuing on behalf of an institution. So the goal here is to answer all your questions, to tell you what Creighton wants to do, and then seek approval of resolutions at the next meeting. So without further ado, I thought I'd give you a quick rundown of what Creighton is attempting to do here. So they actually have 2 bond issues that they're seeking approval for, a public and a private. By public and private, so they will actually go out to the public markets for one of their bond issues, and then they are selling a separate bond issue privately. Both of those are being facilitated by Barclays Capital out of New York. We will have to do a public hearing, also known as a TEFRA hearing, for both of those, which will take place next week as well. As was alluded to, there will be a refunding component, or one of the bond issues will be a refunding of prior debt, and one of them will be what we call a new money issue. And that new money issue is funding a series of exciting capital projects at Creighton. I just made a quick list. So there will be a new residence hall, a renovation of an existing science building, and then the construction of a new health science education building. All very exciting at Creighton campus. As I always try to repeat for this group, there is no liability to the county on this bond issue. They are truly acting as a conduit, meaning you all have bonding authority that Creighton can access through the Nebraska IDB Act. So there will be no liability through either of these bond issues for the county. So it's not a count. While I'll say Douglas County bond issue, the payments only come from Creighton's obligation to repay that debt obligation. That's a high-level summary. I'm happy to answer any questions you all might have. But again, we wanted to get out ahead of this before asking for approval for a resolution and just give you the details of those bond issues.
Thank you very much. Commissioner Kavanaugh?
Thank you. Just a quick question on the refinancing aspect. You're refinancing because interest rates have come down?
Actually, no. So interestingly enough, this is Creighton had a long-term debt issuance where they structured what they call 5-year direct purchase periods. So while the debt has a long-term life, they actually every 5 years would try to resell that debt, and this is an opportunity to go to a different purchaser. So the debt was previously with Wells Fargo, and Barclays has come in at an attractive rate, and so they are actually taking out that debt with a refunding. So while there will be, Commissioner Kavanaugh, debt savings, it partly is due to the fact that it's a sort of a cycle of a 5-year reselling, if you will, of that long-term debt obligation.
Okay, so when you refinance this debt, every 5 years, you go out to see where you can get a better deal financially. Mm-hmm. And so is that predicated on an interest rate?
There is a variable rate interest rate associated with the debt. And so sometimes then the purchaser layers on what we call a margin factor. And so that actually is the pricing component that Creighton is trying to get the lowest rate on. So there's an indice, SIFMA, LIBOR, a published indice, and then the purchaser layers on some of their own pricing. That's what's being competitively priced in the marketplace.
I see. So this is separate from the ongoing bond interest rate that you're talking about. This is almost a marketing component that's added on.
Yes, that is correct.
Okay. The underlying interest rate for these bonds over the last 5 years has gone up, down, or stayed about the same?
Down slightly, but as you know, or I assume you know, so that indice is reset sometimes weekly, sometimes monthly, right? So lots of up and down, but it is down slightly if you were to trend it out.
Okay. And I think you indicated these are adjustable rates, so the rate actually follows that fluctuation?
That's right. So again, just so I'm clear to you, there is the public debt will be fixed rate debt. This is just the privately placed debt is the variable rate debt. And it has, I believe, a monthly reset component where it's taking a look at the set indice, seeing what it is, and then laying on that margin factor to determine the interest rate for that month for the debt.
Okay, so this public factor, the public interest rate, separate from that.
Yes.
Over the last same period, 5 years, has gone up, down, or stayed about the same? If you know.
Yeah, I would guess slightly down, but I'm not 100% sure.
I appreciate that.
Yeah.
I was just trying to get a little background.
Yeah.
Thank you very much.
Yeah, sure.
Okay, is there a second? Oh, it's
We-
Tuesday,
Yeah.
Tuesday, July 27th. We
Yes.
have to wait. Sorry, I
I
misread
think we're on the
that.
consent agenda next week, I hope.
Okay,
Unless you all have other questions I can answer.
okay, all right, okay.
Teresa, York County Attorney's Office. We may need to move, we have a separate section for public hearings. We might want to put it there because of the TEFRA.
Oh,
But
yes.
if I may,
Thank you. Thank you all, as
All right,
always.
Thank you.
Madam
Alright.
Chair, may I, real quick, just the notice that was published in the Daily Record for next Tuesday's public hearing. So yeah, it does, well, Teresa's a lawyer, so she doesn't need me to back her up, but the notice was a public hearing on the 27th, so it does need to be under public hearings. But I want to note that the notice says in room 702, and obviously it's going to be happening here in LC, so we'll make sure a corrected notice gets put in the Daily Record, but for some reason it was published as room 702, so we'll get that fixed.
All right. With that, we will move to public hearings. We do have our budget hearing and adoption of requested fiscal year 21-22 Douglas County budget. And our financial, fiscal and budget director, Joe Lorenz, will be presenting today.
Morning, Commissioners.
Morning.
So in this year's requested budget, I want to take you through a few charts. The first one I'm showing is the tax levy over the past 10 years. And you can see over that period, it's increased twice. Once about 9 years ago, and then 3 years ago, we increased it by $0.015, basically to fund the cost of the new Juvenile Justice Center. And at that time, we took the $0.015 increase, acknowledging that, you know, once the bonds were placed and the principal payments kicked in, that we might have to increase the levy up to another $0.015. But I think the good news is, based on the trend we're seeing in terms of property valuation increases and the projected budget and cost of the new Juvenile Justice Center, at this time I am not anticipating that we will have to take another levy increase. That I think the levy at 29.559 cents at this time looks like will be sufficient to fund the county cost on a go-forward basis. The second chart I want to show you kind of breaks down, we all here in the county are concentrated on our particular budget, but when the people pay their property taxes twice a year or most people pay them twice a year, you can see on this chart really breaks out the various components, and you can see that the county portion of the total levy is only 13% of what people pay. The city of Omaha's is, 50% larger at a little over 21%. But of course, the most significant portion is for the schools, accounting for 55 cents of every dollar of property tax. So in terms of, total tax payments and what people pay, the county is really not driving the bus. It's really the schools, and to me, this is always an issue where we all know property taxes are very high in Nebraska, but why are they so high? It's because, excuse me one second here. Sorry. Why are they so high? It's because that we really don't, the state ranks, in the bottom 5 of the state funding of schools. So the tax burden for the schools really falls in property tax. And I think that's an issue that they don't really talk about much in Lincoln when they talk about the property tax burden. And I think this chart really brings that out well, showing that the majority of money is really in the total levy is going to fund schools. Okay, so a summary on the requested budget. The budget contains no increase in our tax levy on assessed property values. Right now, the budget assumes a 5.5% increase in total county assessed property values. That's based on preliminary numbers from the county assessor, though that number will be finalized on August 20th. Our requested budget, which excludes $55.5 million in ARPA funding, is about $460 million, which is 4.9% above last year. And it was driven by a significant increase in pandemic-related expense at the health department, which has offsetting revenues, and that we think those expenses for the vaccination process will be reimbursed either from the state or through ARPA funds. And there's also some increase in general fund operating expenses. The general fund budget of $230 million is 5% of last year, and that's primarily due to increased expenses for the criminal justice system and costs related to technology upgrades. As I said, the hearing regarding the final tax rate will occur after the final valuation is certified on August 20th. So, during the budget process, we had 7 groups come and testify in front of the Finance Committee here on why they couldn't meet their targets. And I think it's interesting when you look at these, the top 4, county attorney, public defender, sheriff, and corrections, in terms of not meeting their budget targets, are repeat offenders. And so why is that? I think that really ties into this whole issue of the criminal justice system and how it's operating, and then it's running at rates of increase that are, above our inflation and above our targets. And I would say on an ongoing basis, that's probably going to continue to happen until some reforms or changes are made to that criminal justice system. So it's almost becoming a systemic thing right now, the cost of the criminal justice system. Whereas the other 3 departments that came in front of us, county clerk, human resources, and GIS, I think were all kind of one-time issues where they had a one-time expense that, and I don't expect next year that we would see them some, on that same list. So back on the revenue side, you can see an issue.
Hey, Ken or Carr, give me a call at your convenience, 402-651-2528. I think we have a call.
Mr. Har, you're not on mute.
Okay, thank you.
Call Irwin Financial.
Please mute yourselves if you're, for those attending via Zoom. Thank you.
So in our revenue, you can see again that the largest source by far for property taxes and a source of revenue in Douglas County is property taxes, accounting for almost 44% of our total revenue. Then the next largest component would be the fees coming through the general fund departments, and then the revenues through the health center and the CMHC. So you can see that, we are kind of on a one-legged stool in terms of tax revenues, and that we're very dependent on property taxes, which is kind of been a two-edged sword, is that the property tax receipts have remained very strong through the pandemic, whereas other entities that are more dependent on sales, restaurant or income taxes, I think there was a more significant impact of the pandemic on those taxes than there were on the property taxes. So our revenues have come in very much consistent with budget, and for the most part, our fees have too, in terms of automobiles and property and things like that. All those are trending pretty strong, although certain revenues, like at the health center, are down because they put a moratorium on admissions with the pandemic, and so that hurt their revenues in that period. But overall, the county's revenues have remained strong through this process, and we've been in a lot better shape than a lot of other government entities. And then the last chart just shows the increase in taxable valuations over the past 10 or 15 years. And you can see, particularly in the past 4 years, the property tax valuations have been increasing over 5%. And so when it's in that 5 to 7% range, it gives us some financial flexibility as opposed to, I know many of you remember a few years ago when we were in that 1 to 2% range, and we had that, deficit every year that we had to deal with. When they're in this 5 to 7% range, it gives us some flexibility, which is really how we've been able to cover dealing with these increased expenses in the criminal justice system. And with that, I'd be glad to take any questions on the budget.
Thank you, Joe. Commissioner Kavanaugh?
Thank you. And thanks for this, Joe. This is one of the more important things that we do every year, setting our budget and tax rates. I think I got this yesterday, and I know that the discussions you and I have had over the last month give me some background, but just a couple of things that maybe content-wise would help going forward. It's good to see where the mill levy's been over the last 10 years, and it's good to see where the revenues have been, or the valuations have been over the last 20 years. It would be also helpful, I think, for the commissioners, but certainly for the public who access this document, to see where the budget has been over that same period of time. If we could get a look back on that, I think we're north of 500 million this year.
Yeah, with the ARPA money, we're north of 500 million this year, right?
Right. So, if we could see that, because I'm looking at this and kind of just doing on the back of an envelope for myself, the percentage increases here, it would give us, maybe more of a context to what we're doing.
Yeah, I could pull that together. I think they've been low single digits. I think they've been in that 3 to 5% range.
Okay. you know, this is great. It's about $100 million per page. And I know that because you provided it to me, there's more information available, and I hope that that's available online on the county's website. If it's not, maybe we should put it out there, because I know you have it. You know, I've talked about this, but from a process point of view of doing something that we used to do relative to this, and I'll get to that in a minute, but just relative to the revenue thing, you indicate in here that we're doing this exclusive of any American Rescue Plan funding. And in our hearing yesterday on that, and the information you've given us, that's going to be about an extra $55.4 million this year and next year that we receive from the federal government, in part to address revenue questions on the local level and the impact of COVID on governments and individuals has been, you know, kind of challenging. I was wondering, relative to people impacted by COVID who have property tax bills, it appears to me that the American Rescue Plan would allow us some latitude to provide relief to people, not unlike what the state does and has done traditionally from a homestead exemption point of view for people that are on limited incomes and in retirement mode. Are there some aspects of the American Rescue Plan monies that could play into this budget cycle?
Well, I think that in terms of the loss of revenue you were talking, there is a loss of revenue clause in there that you can use to offset shortfalls in fees and revenues that you receive, and we're exploring that, looking at the different departmental fee generation. But on a tax standpoint, that's what I was talking about, the property taxes, they have not been that impacted, where as opposed to the city of Omaha, where because they've had a fairly significant shortfall in restaurant and sales tax, I've been hearing that they are looking at potentially using up to half their ARPA funds on the lost tax revenue as an offset. But we have not been that dramatically impacted, and so we'll come up with a number. My guess right now, it'll be more in like a $5 million range for us, which would mean the majority of our $55 million we're going to be able to use for different purposes in the county and also for other organizations that qualify.
And I'll appreciate that. I'll come back to this in my second half, but I'm looking at, you know, kind of two sides. Yes, the government shortfall of lost revenue, and then the individual, which is also allowed for under ARPA, impact of homeowners paying property taxes that, you know, COVID has put a lot of people on the sidelines. We just heard from the health department, tens of thousands of people affected by this. It's affected their employment, it's affected their income. And so going there with some of that. We'll come back. Okay. Thank you.
Thank Commissioner Friend.
Thank you, Madam Chair. Joe, thanks for the report. You know, PJ and I are, I guess, co-chairs of the Finance Committee. For about the last 2 months, when I really want to put myself to sleep at night, I take your information and just lay down, and 20 minutes later, I'm sound asleep. That's only about half a joke. That's Joe. I said when I first got here I wasn't going to take pot shots at the legislature and do things I think that would cause this entire board consternation, but I don't care anymore. The time that I spent in there, and as I crunched these numbers and put myself to sleep at night, and I wanted your opinion on this at the end. It wasn't just a bloviation on my part. We have a tax system that's a third in theory. We've got property tax that we're implementing on citizens, and the county has the authority to do it. We also have a sales tax system, and we have an income tax system in this state. It's my contention, after all the time I spent on this in the Revenue Committee and all the other stuff that I've been doing, is we have the governor, we have the legislature in the state of Nebraska over and over and over again. By the way, 3 governors that I've seen do it, at least 4 legislative, sections of time talking about this. How do we reduce property taxes? How do we reduce property taxes? Over and over again. And I'm going to say something here, and I'll go down next year and talk about it with them. We have a sales tax system that is dysfunctional. We have all kinds of carve-outs for everybody around the state in order to make it amenable for people in the state to actually purchase stuff, right? Go look at South Dakota and you'll see what I mean. Go look at Florida. Go look at other states who have low property taxes. The other thing is we have an income tax system that's been carving out stuff since ConAgra got here back in the late 70s or the early 80s, right? And asked for that type of money. So what I'm getting at is we have a huge property tax burden. We also, as county commissioners, have 13%, access to 13% of that. So we crunch budgets, and then we have essentially core functions like corrections and other things that we have to fund. And by the way, 3 of the 4 are also elected officials that are trying to manage budgets themselves, right? The sheriff's department, county attorney. I guess what I'm asking you is, we can sit up here until the cows come home and start lowering levies and doing all kinds of things, but that does not solve the property tax problem in this county. Can you opine on that right now? And by the way, I'm a little miffed at this point. Can somebody shut me down? Can you?
You have a minute and a half.
Do I have a minute and a half? Okay. So
Get it out, Mike. Get it out. Get it all out.
it's been going a long time. Joe, what I'm saying is we have the capability to actually do things and fund things to the point where we're obligated to fund it, right? How much jeopardy would we put in if we actually lowered levy lids? How much jeopardy would be put in right now from a reserve standpoint if we started doing things like that we have obligations to meet, right? Because that's our power. We can lower levy lids, but let me go back again. If I believe that the sales tax is dysfunctional and the income tax in the state is dysfunctional and they got carve-outs all over the place to deal with all of these special interests, what value are we providing? What do we put back in a pocket if we lower it 0.5%?
Yeah, I think if we lower it, half a penny, it's more symbolic than anything else. I don't think, because ours is only 13% of the total, if we take it down a little bit, it's really got to not impact people's taxes. And I think the issue is, if we could always assume that property values were going to be increasing 5 to 7%, it would be something to consider. But, you weren't here, but a lot of us lived through it when we were in that 1 to 3% property tax appreciation range, and the budget was very painful to do at that. So I think you always want to leave yourself a little bit of dry powder in case things aren't as rosy as they are now.
All right, thank you. Commissioner Kavanaugh?
Thank you. Following up on Commissioner Friend's observation there, my review of this, Joe, correct me if I'm wrong, indicates that taxable valuation for 21-22 seems to have increased 5.5%.
That's the initial numbers coming out of the assessor's office, correct?
And the budget over that same period of time, the budget proposal is coming in at an increase of 4.5%.
5%, or 5%.
5%.
So, yeah.
So just capitalizing the increase in valuations and translating that into budget dollars, would those offset roughly, or would there'd have to be some offset?
It's close, but remember that the tax revenues only account for about 50%, 45% of our revenues. So we have the other fees and stuff on top of it.
I appreciate that. What I'm saying is, and I've advocated this in the past, made this motion, and I would be very interested in talking to Commissioner Friend about doing this. is a property tax mill levy reduction based on that arithmetic. We may not be able to get the whole 5%, but there appears to be an overlap number of dollars there where we could actually propose a reasonable property tax mill levy reduction based on the appreciation of real estate values that has happened over this hot real estate market.
And I think what I talked about in the beginning is that originally we had projected that we were going to have to increase taxes 3 cents. And now I think what this property valuation is providing us is to really have only increased it by half that, by $0.015. And by doing that, you know, we were looking at a future tax increase that it looks like now we're not going to have to do. So that really is, in my mind, you know, serving the same purpose as a future, as a current reduction is not having a future increase.
Okay. Well, I think, you know, hopefully over the next period of time before we approve this budget, maybe we can have a little more discussion on that, because I think that offers a valuable option, particularly for the homeowners on their property tax bill going forward. Whether it's American Rescue Plan relief to people impacted by COVID, or kind of the idea that Commissioner Friend was talking about and that we just discussed relative to the offset of increased property tax or increased property valuation and decreased mill levy burden. The question that I have, and this isn't one that I'm particularly looking to you for an answer, is, but the board would be wise, I think, to reconsider instituting regular Finance Committee budget hearings. As my colleagues are familiar with, the Legislature's Appropriations Committee does, on not just those outlier departments and offices, as you indicated, there were 7 of them or something this year, out of, you know, a couple of dozen that we have overall system-wide, so that we got everybody in front of us to say, you know, good, bad, or indifferent, we're up, we're down, we're staying the same. We've done this in the past, and we're not doing it now. I think that it's a process that's important, not only to sound fiscal management, but to transparency for the public, so they can see what their money is being spent on. And, you know, as we heard from our corrections director, sometimes it's good news. They didn't spend their entire budget.
1 minute.
I think that's important for people to know. So I would ask our finance chairs, co-chairs, to consider reinstituting that, and certainly I'm going to bring this up going forward, so that we have a comprehensive, like the legislature does, Finance Committee hearings on each and every department and office under our jurisdiction. We may find some savings, and it's stuff that people aren't seeing now. I don't know why we went away from it. It's just good public policy, and we should do that. It would allow us to have a full and robust discussion. We've been on this about 25 minutes. $500+ million. 25 minutes is not enough time to discuss that, and it doesn't give us any breakdown of the departments or offices inside that budget.
Well, in the handout that you all received, there's a 15-page.
Thank you.
Okay.
Commissioner Friend and then Commissioner PJ. Morgan, sorry, Commissioner Morgan.
Thank you, Madam Chair. Okay, fortunately, I haven't had too much coffee, so I'm fine now. What I would like to finish with is that I understand some of the points of view that Commissioner Kavanaugh has laid out, because we've been down some of these roads before. I've sat through budgetary and appropriations hearings. I've also sat through budgetary hearings in revenue committees that actually disperse money for key state projects that, you know, obviously are important. I guess what I'd like to sum up by saying is this. Sum up the whole thing by saying this. I just went through, and I did this the other night before I fell asleep. I went through some of the things that were actually mandated to pay, that we have to pay. Either the state or the feds are actually going to give us cash to do it, or they're going to say, no, we're not going to give you any cash, but you have to pay it statutorily, or the feds come in and say you got to do it. At least 3/4 of the things that we do are actually. Look, I'm not defending us here, because I'm sure that these guys are going to get mad at me sometime in the future because I'm going to be doing something that's going to probably offend them, notwithstanding this very, speech. I guess what I'm getting at is, if we can filter through the things that we actually are mandated from the state to fund, or from the feds to fund, then we can do some broken field running. Then we have an opportunity to say, okay, well, how are we going to change the way we're doing business here? And by the way, it's my understanding that all of the previous boards have done this. It's not like they ignored it. I mean, it actually happened. But until, and I'll end it here, until the state, and you heard it last year, they're high-fiving, everybody down in Lincoln is high-fiving because they gave us all property tax relief. Wrong, they did not. Until you change the sales tax scheme here in this state, and until you actually recodify the income tax, you will not address the problems that we have. I would love to make a motion right now to reduce the levy. Here, right now, I'd love to do it. I think it's all smoke and mirrors. I don't think it helps me. I don't think it helps anybody else that lives in Douglas County. I think until you address the real problems, and if I can help do that, I'd like to. The sales tax and income tax burden in the state were blowing smoke in the wind. And so I would ask you to opine on the unfunded mandates and actually the funded mandates that we have and how they compare to the things that we can just decide that we want to try to do, right?
Yeah.
So quickly, I guess. I don't know how much time he's got, but
2 minutes.
you have plenty of time, 2 minutes.
Well, in terms of the unfunded mandates and funded mandates, Patrick and I have been through those many times with the Finance Committee and the board. And if you go and look at them, you want to look at the ones that are material that would make a difference. And, it's always a very hard discussion to have, but by far our largest unfunded mandate that cost us the most money is funding the health center. And that's the one that is the game changer. And like I say, we've had those discussions. It's come down to the board level. It's a very, very tough issue. But if you want to go and see something that makes a difference, it's the unfunded mandate used to fund the health center.
Okay, thank you, Joe. Thank you, Madam Chair.
Commissioner Morgan?
Joe, you wanted to say something when Commissioner Kavanaugh's time was up. You started to say something. I don't know if you recall.
Oh, yeah. I was just going to say that, I just, for the purposes of this presentation, gave this little 6-page summary, but all the commissioners should have received in their booklet, there's a 15-page PowerPoint presentation that lists the budget by every department, by every fund, the sources of revenue, and is very detailed. I think that's what Commissioner Friend was talking about, reading before he went to bed at night. So we try and make this budget process as transparent as possible, and all the numbers are out there for people to see. And we put that document and the budget on the county website and the clerk's office. So we certainly, like I say, are all about making all the information we have available to the public.
Okay. I wanted to be sure that you were able to do that. And I would say also that Commissioner Friend and I talked to you almost every week for the last 3 months and other times during the week about the budget and different parts of the budget constantly and checking on things. I'd also like to say I don't think there's any way that you can use the government funds to give property tax relief. I'm not sure how you could discriminate or be able to give it to everyone when you start to think about it, and it wouldn't make a minute difference. For example, and Joe, you correct me because you're great at this. The fact is that if you're paying $5,000 in property taxes on your home,
Yeah.
you would, if we reduce the mill levy of the county's part of that budget 10%, you're talking less, probably less than $50 is what they're gonna see, which means you're gonna get about a $4.38 reduction in what you're paying in taxes a month, which, as you said at the outset, if you look at that chart, 55%'s going to the schools. And what Commissioner Friend said is what needs to be looked at in the legislature, because I can give you the example. If you buy the same price home in Colorado, the state, or Arizona, you're gonna pay 25% of what you pay here in the state of Nebraska in property taxes in Colorado. If you do the same purchase in Arizona, the state of Arizona or Scottsdale or whatever community you want to live in, you're going to pay about 33.5% of what you pay here in property taxes. So that's what you were talking about, how the legislature, the state has to deal with it because that's what they're doing. And their sales tax is very similar to our sales tax. So that's where we are. And if you're in California, then it's really low. I mean, it's 1% of whatever the value of your home is. So if you own $1 million home, you pay 10% in taxes, or $10,000, excuse me,
Yeah.
in taxes.
And one other thing I would say is in the ARPA guidelines, there is, in big print, this ARPA money cannot be used to reduce taxes. That one is pretty clear.
1 minute.
So thank you for the work you've done the almost 11 years. I think this may be your 11th budget that you've done, and I thank you for your work and your diligence.
Thank you. Commissioner Maureen Boyle?
Yep, just a couple things. One is when you mentioned that the biggest unfunded mandate we have, it's the health center, or is it the correction center?
Oh, the correction center is mandated.
Oh, it's mandated. Okay.
Not funded.
But, so that's.
Not funded, but
So the correction
mandated.
center is an
But it's
unfunded mandate.
Yes.
The correction center is, so is the health center, you said Douglas County Health Center is our largest,
It's just we're not mandated to do
We're
it.
we're not mandated by statute to.
we're not mandated.
No.
Yes.
Okay, got it.
And it's unfunded too.
That's
Well,
unfunded,
partially funded.
Right.
Partially funded, yeah. All right, so the biggest chunk to our budget coming from the state for those mandates is what, the correction center?
In terms of the size of the budgets, yes, it would be corrections.
Corrections, okay. So when you look at just operationally, the things that, you mentioned that the departments that submitted requested budgets in excess of their target, 4 of the 7 were repeat offenders, you called them, and they all fall under that headline. That's, corrections, sheriff, public defender, and county attorney. So
The criminal justice system.
the criminal justice
yes.
system, basically, yeah. So I really think we have to spend a lot of effort in how do we address that, just big picture wise? Strategically, what do we do to bring that budget less? Because if obviously we're assigning a budget to them or whatever, and then every year we're having to increase it, this is a runaway train at this point.
It is.
So I think we're really, it's very critical for us as a board, but really each individual department there, the county attorney, the public defender, the sheriff, and corrections have to look at what they can do within their own systems so that their budgets can decrease. So I'm not saying that they go across the board and cut it 10%, although that's something to consider. I'm saying, what do they do that is inefficient, and then what can we do to provide a service or a new product or something that will make them run more efficiently. So I really think that it's important for us as a board to look at those things, number one. Number two, I think that within those departments, I think we have to encourage them or figure out a way, or even have them set up a little committee or something, looking at what they do individually so that we can, I mean, this is the big bust to hit. We need to figure out how do we go for the most costly thing in our budget and have that thing addressed more than nickel and diming. And so any thoughts you have on that, or if you can think about a strategic plan to go with those departments so that they don't come to us every year asking for more money. I mean, it's not sustainable.
Patrick Bloomingdale, County Administrator. Well, the number one issue is the number of people in the system.
Exactly.
The number of people that get into the court system, the number of people that get into our adult jail. And obviously we work with the courts, with probation, with the county attorney, public defender, law enforcement to find ways. And, you know, we've done a pretty good job in that regard, but, you know, corrections, obviously, as you know, has no control over who comes into their doors. So, you know, we continually look at ways to do that, but it is kind of a runaway train, and we don't have as much control over it as we'd like. It's not, you know, sitting down and looking at the little things within the departments and offices are fine, but if you really want to look at the big saving, I mean, the material savings, substantive savings, it's keeping people out of the system, both at the adult and juvenile level, and it's looking at your non-mandated items. You know, Joe mentioned the health center, which I support, but you know, if you want to have non-mandated valuable services like that, you've got to pay for it.
Right.
And you can't do it unless you're going to do it right. Do it safely, provide quality of care, and if your choice as a board is to do that, you're going to have to pay for it.
1 minute.
So going back to the corrections idea, or look at the court system, what if we did more mediation instead of having people go into court? I mean, there are ways to fund that, and that would cost money up front, but it would save time in the actual court system. We could process people faster so they're not sitting in jail for long pre-trial. So there are all kinds of ways to increase efficiencies there. So I'm asking for those types of ideas, and the people who are doing the work may know those ideas, that would absolutely know where those economies of scale or efficiencies could take place much better than I could as someone who's completely unfamiliar with the justice system.
Yeah, and I guess the good news is we're not alone in this. This is a national issue about criminal justice reform and the increasing cost of it. So
I think we have to figure out a program or some type of approach to this, I guess, is the bottom line. I would like us to look at that much harder and have them do it internally.
Time. Commissioner Morgan?
Boyle, I'll mention a couple of things. One, on the correction, we used to get money, and Commissioner Mike Boyle would tell you, we used to get money from the state, millions, and now we get zero. And it wasn't that many years ago.
30 cents.
Yeah, 30 cents. So that was something we used to get that's not there anymore. The other part of it is we do have did have the public defender and the county attorney come here to the board and tell you because of personnel and needs, they had to have additional money in their budget. You know, they did appear before us, and we did have an opportunity to question them on it. And I'm certain Don and Mr. Riley would be, Don Klein and Mr. Riley would be happy to talk with us about that. But it's a personnel matter of what's going on. And I think Mary Ann's program and Chris and all of us on the mental health area hopefully is going to be helpful to do something more. And I think it's 48% of the people that are in those centers, the correction facilities, have dyslexia. And we don't really deal with that at all. We met with Clarice, my friend and I did, hearing about what they're doing in those percentages, which is amazing. I never knew it was that high, and the difference of that effect on them is unbelievable. So there's things I think we're going to work toward and use some of those monies for in the very near future, Mary Ann, and you can correct me on that, but I think that's where we need to be. And I know that Mike Meyer has said he operates the largest mental facility in the state of Nebraska. So it's a tough one to deal with, and we'll keep working at it.
Yes.
Thank you. Commissioner Maureen Boyle?
And again, I just want to clarify, in no way am I criticizing the work that all of these people do. They've got one of the hardest jobs on earth, for sure. I think just my point really is that there are inefficiencies in any and every system out there. And so if we can figure out a way to stop this runaway train, I would completely support it. And I think we have to be much more proactive, or as proactive as possible, about doing that. So that's really, really my point. I think we need to look at the biggest chunks of our budget and figure out, if you look at the biggest pieces, any cut there is going to have the biggest impact to budget. And so, and I know they're looking at it to a degree, but I think we should really try to come at it and be even more creative about it if we can.
Yeah, I've done some work on pulling together the numbers, and an amazing number to me is that if you include the Omaha Police Department and probation, that over $300 million a year is being spent on the criminal justice system in just Douglas County.
Yeah, that's too much. I mean, we have to figure out ways to get people out of the system and really steer them so that those services aren't even needed.
Okay, thank you. All right, this is the public hearing on our budget. Is there anyone in the chamber wishing to speak on the budget? Doug?
Good morning. Doug Kagan, 416 South 130th Street, representing Nebraska Taxpayers for Freedom. Recognizing that the Douglas County Board has only limited budgetary oversight over several departments headed by elected officials, we nevertheless are very disappointed at the lack of or sparsity of documentation provided by county departments and agencies to the county board and taxpaying public during the annual budget setting process. And I don't mean the administration, I mean the departments. Departments appear to provide only the minimum documentation, if any, required by county commissioners. This situation makes it almost impossible for taxpayers to examine these several budgets in order to find waste, inefficiencies, or duplication of services. Also, it is extremely difficult to discover items and areas in which these budgets actually are saving taxpayers money and becoming more efficient. Therefore, we offer the following remedial suggestions for improving individual county budgeting processes. 1, every department and agency should use the same formatted template that provides the same information in the same places. This procedure would allow taxpayers to more easily read through the content. 2, as the county board did previously, hold weekly spring public budget hearings for groups of departments and agencies so that taxpayers can see and hear their presentations and ask questions. 3, require every county department and agency to implement zero-based budgeting. Currently, they must justify additional requests for funding only above a figure set by the county board. Utilizing zero-based budgeting would require them to justify every expenditure every fiscal year. 4, institute department accrual accounting, an accounting method in which revenue and expenses recorded when a transaction occurs instead of when payment received. This method follows the principle in which revenues and expenses recognized and tabulated in the same accounting period. It prevents departments from requesting revenue for expenditures not made during a fiscal year. 5, salary adjustments. Require mid-year upward salary adjustments during a fiscal period to use funding already appropriated. 6, a report at the end of the fiscal year showing how actual spending compares with the amount approved in every budget. However, we do commend the board for maintaining the current property tax rate. The debt service is lower. Several departments submitted lower budgets. Revenues in several areas scheduled to increase. And added costs to the current budget because of the pandemic will not adversely affect future budgets. Thank you.
Thank you, Doug. Anyone else wishing to speak during the budgeting process or budget hearing? All right, with that, do we have, we can take action today on the budget? Is there a motion to approve?
Madam Chair, can we close the public
Oh,
hearing?
I'm sorry, I'm going to close the public hearing. Is there a motion to approve?
Second.
Motion by Commissioner Rogers, seconded by Commissioner Morgan. Please vote.
I have some comments.
You've already spoken twice on the budget, Commissioner Kavanaugh.
Yeah, I'm speaking on the motion. We have right to comment on the motion.
Go ahead.
So this is a budget of over $500 million that we've talked about for about 50 minutes. You can do the math on that.
Commissioner Kavanaugh, give us 1 second here so we can get your mic working.
Oh, sorry.
You have to
Yeah,
erase
stop
the...
the... Okay, Ron, you should be able to get his mic on now. There we go.
We good? Okay. This is a over $500 million budget that we've talked about for less than an hour. That's way inadequate discussion. I was glad to hear Doug Kagan, Nebraska for Taxpayers for Freedom, endorse the idea that we return to the regular Finance Committee hearings on all offices and departments. That's just good fiscal policy. It's woefully inadequate to rush these things through. There have been questions that Joe was good enough to entertain relative to additional information that would be valuable to have before we pass on this budget. There would be absolutely no impact on the operations of Douglas County government if we laid this over for a week and allowed for further inquiry into this better than $500 million budget. And that's all I'm asking, is that we lay it over, we not rush the judgment. It can only result in possible savings, and it does no harm. So I would ask that we lay over this motion for 1 week.
There is a motion that dies for lack of a second. There is a motion on the floor to approve the budget. Any further questions or comments?
Just a comment, Commissioners, if some of you, I think 2 or 3 of you voted, but we're going to have to start over, so we'll ask you to vote again,
All right.
just so you know.
Okay.
And so we are ready when you are.
Wait a minute,
Oh, I'm sorry.
Madam Chair, so,
This is the motion on the floor is to approve the budget.
but Commissioner Kavanaugh actually spoke before the vote was taken, correct?
Right.
Okay, all right, sorry.
And it was, there
Yeah,
was
I
no
don't-
second.
I don't, I mean, I can comment on that if I have the capability.
No, there's no second.
Okay.
So the motion on the floor is what's on your screen to approve the budget. Please vote.
Motion passes 6-0.
Thank you. We'll move on to committee discussion and actions. Nothing further on the Finance Committee other than the usual budget report as presented. Under Child and Youth Services, we have the Douglas County Juvenile Justice Report by Ms. Kim Havakati.
Sorry. Good morning, Commissioners. Kim Havakati, Deputy County Administrator over our Juvenile Justice Reform.
Good morning.
I do have up on the PowerPoint some updated data with regards to the Douglas County Youth Center. You also should have a report sitting in front of you with our most recent data. So first snapshot, let's take a look at gender. And what we did on this report is we compared a year ago to today's date. And then I have slides coming up which does look over the last 15 years and what our numbers look like. But when we look at gender a year ago compared to now, you can see we're running about 90% male, about 10% female. That really has not changed much. The female has gone up and down. What our biggest concern about our female population is when we did an analysis and looked at our female population, previously a year or two ago, most of our females were in detention due to violations of probation or maybe waiting for placement changes. Today, they are in there for a lot more felony offenses. So the offenses that our girls are committing as juveniles has gotten more severe than it was in the last year or two. So we're working on that particular issue. So let's look at race and ethnicity. So we compared it to a year ago compared to now. As you can see, disproportionality has not improved at all. As you can see, it's gotten even higher. As our numbers have gone down at the detention facility, our disproportionality has increased. So the good news is, as you'll see coming up, our numbers are down a lot from the last year, but our disproportionality is there. So we have it broken down between each of the races, and we compared last year to this year. So when you look at the combined minority, we're running about 94.5% youth of color in our detention facility. So let's look about, again, what court are these youth in? Because again, as to what the system response can be to these youth, it depends upon if they're charged in our adult criminal system or in our juvenile criminal system. So we compared a year ago to today. While you can see while the numbers are down, our percentages are pretty much the same. About 55 to 58% of the youth are involved in the juvenile court system, and about 40 to 45% are involved in the adult criminal system. Age. As you know, the youth there are anywhere from 13 to 18 years of age. 2/3 of the youth in detention, both compared to last year and now, are 16 and 17-year-olds. The other 1/3 are under the age of 16. Our number of 13-year-olds has increased, and that's been recently. Length of stay. I know you guys have heard me discuss often that it isn't necessarily the number of youth that's in our facility, but the length of stay that impacts how many youth are in detention. So when you look at the adult court length of stay compared to last year, it's increased drastically, which then has impacted our numbers. So right now, our adult court length of stay is about 165 days. Our juvenile court, on the other hand, length of stay has decreased by about 3 days, not drastically, but we are working on decreasing that number so that we can impact it more. But the adult court, as you guys well know, because it's been talked about, all during COVID, we really did not have the district courts operating during that time period. So our youth have been sitting there quite a while. Admissions. These are the admissions into DCYC beginning in January of 2019 through June of 2021. We did it between male and female. And as you can see, the number of admissions has, over the last 2.5 years, gone down. We had a low period, as you could see, in April of 2020, and then went up a little bit in the fall, which is not unusual for our youth. And then again, at the first of the year, we have been averaging admissions of right about in the 45 to 48 range every month, which is a drastic decrease you'll see coming up when you look at the historical history. This is a presentation from 2007 because I know Commissioner Kavanaugh likes to look at the past. So here goes back to 2007, looking at our admissions into DCYC. How many in a given year were admitted in DCYC? As you can see, that chart has gone down drastically, especially in the last year or two, because back in 2007, we were admitting over 1,700 youth. Last year, we admitted 717. So that is a drastic decrease over that time period by admissions. So then what we did is we broke that up from 2007 through 2021 based upon court type so that you could see, has there been an increase in our adult court population or has there been an increase in our juvenile court population? You can tell that both have been a decrease since 2007 and 10, but really it's been the last 2.5, 3 years that we've seen the larger decrease. Next, we broke that same data up based by juvenile court status. In other words, are they adjudicated? Are they under probation? Or are they pre-adjudicated, which is the county's responsibility? So your chart on the left really looks at our juvenile court status. You can tell, and the reason as I talk about some of our programs and services it's relevant, is that in the past year, the pre-adjudicated youth number has gone from 473 last year in 2020, and so far in 2021, which we're halfway through the year, it's 162. So our pre-adjudicated youth, that front door into detention and the responsibility of the counties has gone down. But it has directly impacted one of our programs, and that's our home program, our electronic monitoring program, because we just don't have as many youth that are pre-adjudicated that need electronic monitoring or an alternative. And then also we have it broken down on the right-hand side with the adult court status, how many are pretrial and how many are sentenced. Now, we don't really have many sentenced youth in the adult criminal system at DCYC. They usually do go to what is the adult criminal system corrections, adult corrections, NCYF. Commissioner Borgeson, I know you love the zip code. Here are our zip codes. These have not changed. We compared it to the last 3-4 years. 68111, 68104, and 68107 are our highest admissions into DCYC. And that has been that same way for the last 3 years. There has not been any variance. Next highest is 68111. And if anybody wants this broken down more, just contact me and I can get you the exact numbers for each of these zip codes. I'm more than willing to do that. So some ongoing projects within the Douglas County Youth Center to update you on the programs and services. We still have the Behavioral Health Initiative. It is still growing strong. The board did have a presentation from that initiative, maybe 3-4 months ago, 5 months ago. It is a collaborative between UNMC, CHI, Charles Drew, state probation, where weekly we look at youth that have high mental behavioral health needs. That is still occurring. We are in the last phase of our evaluation of that initiative, which should be completed in the next year. One of the positive beginning data we are seeing from that is that our court-ordered evaluations, our mental behavioral health evaluations, prior to this initiative could be running anywhere from 2 to 3 months. They're now down to 3 weeks, which is good for our youth, which gets them into placement faster, which also impacts our numbers at DCYC. Also, as you remember, we do have, and we're given an OJJDP room confinement reduction grant. That started the first of this year and is going forward. Through that grant, we were able to hire a clinical psychologist on staff at the Douglas County Youth Center. We hired Dr. Donna Stewart, who started about 2.5 months ago. And it has made, in my opinion, a tremendous difference at the youth center, having that clinical psychologist on staff to meet the needs of our youth as they are happening, but also to assist in directing our staff and services in that mental behavioral health area. So that has been a positive under that grant. We also are in the process, we are redoing all of the mission, vision, values, and policies at the Douglas County Youth Center because it has been a while, and to really make it more based upon positive youth development and ways that we should be dealing with youth with regards to room and confinement. Starting next year under that grant, all staff will be trained in some evidence-based programs to assist. Also within the Douglas County Youth Center, we are implementing some screening tools of all staff. The first screening tool that we are implementing is called the Maisie 2. It's a mental behavioral health screening tool that will be given to all youth as they enter into the facility so that we can try to ferret out earlier those that have the highest mental behavioral health risk. We also are working with UNMC for this fall to implement a screening for traumatic brain injury. When UNMC did a study in Lancaster County, they found that about 2/3 to 75% of the youth in detention had a traumatic brain injury, which does impact their ability to learn. So we're going to be implementing that, and also at the request of Commissioner Mike Boyle. So Commissioner Boyle, if you could tell them, we're also looking at the lead screening process so that we could look into that, because that impacts our youth. We know currently our reentry rate back into detention is about 70%. We need to be doing as much as we can while they're under our care and detention to assist them for when they get out so they don't come back. I know there was going to be some questions, so I'm going to bring this up. Douglas County Youth Center is not currently wide open yet to all of our programs in-house. We have been working with the health department this week to figure out the safe way to do it, because we are dealing with youth and staff because of COVID, but it is our plan within the next month to start opening it up to our programming within the Douglas County Youth Center, because that is so important to us. Now, we have had the therapeutic services and things like that, but not our outside community providers that come and work with our youth. So we are working on that piece of it. So I just put this up here because I know you guys have seen this. All of the current programs on the that are listed here are still occurring. You'll be seeing next week all of our community-based grant funding for this upcoming year. It was about $1.33 million that will be going out to providers. The Missing Youth Initiative, I wanted to bring that up. The Missing Youth Initiative deals with anywhere between 80 to 100 youth every day that are non-system involved youth, so that they are not under child welfare or on probation, that are missing or running away from home in our community. And what we have found through some of our data analysis is that if kids are running away from home, that's a pink flag. There's something going on, that if we can get services to them earlier, then hopefully we can keep them out of the pipeline to the juvenile justice system. So the Missing Youth Initiative really works with Omaha Police Department, Project Harmony, and through some of our grant funds where they are providing services directly to youth as soon as they are missing. They're doing assessments, evaluations, and then providing the family with assistance to try to change that. Now, with regards to Missing Youth Initiative, when we looked at it, we know that about 2/3 of our missing youth are girls, and mainly girls of color, and that was a concern to us. So we did apply for a federal grant to get some extra funding to try to expand those services into our youth, our girls of color, because we know what happens to those girls from a sex trafficking and a straw purchase standpoint. With regards to the new initiatives on the prevention, early intervention, the Family Resource Center concept is going forward. I want to just give a very short definition of Family Resource Centers are a family-centered, strength-based community hub that provide culturally responsive support to families. It is a true prevention, early intervention system targeting the needs in the areas where people live. We were lucky enough to get a private funder about 3-4 months ago to fund an Omni Institute to come in from Colorado, who has created Family Resource Centers in Colorado, to work with us. They have completed an assessment evaluation as to where we are in the community. That should be public and released within the next month, and then it would be my hope at the next meeting I'll be presenting with you the next steps on the Family Resource Center and the way we're going. With regards to the alternatives to high school completion, there's a new program I just wanted you all to be aware of, working with Metro Community College. It's called the Youth Forward Academy. The Youth Forward Academy is going to be going into Blackburn to work with those students in order to try to get job training and career path going earlier. The Guns, Violence Prevention, and Early Intervention programs, because I figured everybody would be interested in that one. We know just based upon the media in the last 4 to 5 weeks here, we have had juveniles committing some very serious crimes. We also know that right now they are in our detention facility. So we have applied for 3 federal grants to really target the gun violence prevention early intervention program. The most effective programming that you can see across the country when you look at the research is what are known as credible messengers. They're people on the street that are working with the youth directly, that know the youth. Our goal is to increase the number of those. Currently, we only have 2 or 3 in the community. Our goal is to triple that number in order to meet the needs of our youth. We also are looking and will be implementing within our detention facility and with some community providers something called the Phoenix curriculum. It is an early prevention intervention gang program for our youth so that we can get to them sooner before they're 17 years old committing first-degree murder charges. So we are working on that piece of it. With regards to our system-involved youth, I know I have talked to you before about our stability services. Those are by our home program. You guys approved the contracts about a month ago. And those services have started so that we can try to keep youth out of detention and not have that high reentry rate. Last thing I just want to mention is with regards to our OJJDP Title II grant, the federal government just released the 2020-2021 Title II Racial and Ethnic Disparity Grant. It is due August 2nd. We are working on it. That grant has to be used for programs and services that directly impact racial and ethnic disparities. So we are working with community providers to get those programs. Last thing that we are working on in the racial and ethnic disparity area is one of the areas we felt we were weak on as a county is our cultural competency training, that we have to start working with our providers so that they understand different and are competent in working with all the different cultures. So we have put together 3 sets of trainings. I think you guys, I know you've been invited to all of them, but our first one was our gender-specific training on how to best provide services for girls. Our next one in August will be the LGBTQ+ community and what services we have and what we need to do. And then in October, we're planning a day-long conference to deal with suicide prevention. We know when we look at some of the data from Douglas County, our suicide attempt rate with our youth of color has increased over this past year. So we're trying to impact that. I am open to any questions. I know it's been a long morning, so otherwise you know where I am and I can gladly supply any more information.
Thank you, Kim. Commissioner Kavanaugh?
Thank you. Thanks for this, Kim. This is good information. So on this minority-majority population issue, we seem to be going in the wrong direction. We're now, if I read this correctly, a 94.5% minority population locked up kids.
Yep.
Right? That's up
Yes.
from 87.5%. And in those populations, the Hispanic population and the black population are the overwhelming majority of that 94%. But the white population, white kids, has gone down by more than half.
Correct.
How do we explain this? We're locking up a higher percentage of kids of color and a lower percentage of majority white kids. How is that?
I think we have to first keep in mind that from the Douglas County Youth Center, they do not, and we as a county don't control the front door or the back door.
I understand.
So we have to, and I'm just saying that more for the public. So
Right.
we can't say it's any of us sitting here that control the front or the back door.
Right.
But one of the interesting articles I've just been reading really takes a different look on racial and ethnic disparities, because that's what we have. There is no question we have RED issues within our community. But that racial and ethnic disparity is not the end result, but it's rather an interim outcome of pre-existing problems in our community and our youth. So in other words, we really have to look at the 6 main factors outside of the youth committing the crime, and we have to target our programs and services to get at those youth earlier in order to stop them from getting into the system, because we know once they get into the system where we're sitting, Commissioner Kavanaugh.
Well, I mean, it seems to be happening in this discrete white population because it's gone from 12.5% of the kids locked up to 5.5% of the kids locked up. The only one that's really shown any big decrease. Why is that?
No idea. I mean, I wish I did. I could tell you the filings are down. I could tell you when you look at national research, Commissioner, we're not the only community dealing with this. Every community across the country is. Right. There's an interesting report I will gladly send out to you that was just done by the Sentencing Project, where they looked at every state, racial disparities in youth incarceration persist. And if you look at it, every state is up. That as the numbers have decreased, the disproportionality has increased. But there are a couple of concerning things in this report. When you look at all the 50 states, Nebraska is the 8th highest in the country for incarceration of Black youth. I mean, we have to talk about that. We have to, figure out ways to deal with it. Also, when you look at the youth incarceration by rates by each state per 100,000, we are 4th in the country.
That's troubling. The pandemic had an impact across our society on a lot of things, and I was just wondering, have we been able to determine the pandemic's impact on our average daily population? Because it appears that it had average daily population a big impact on the kids that are there under juvenile cases, but not much, if any, under kids charged with adult crimes.
I would agree with that statement, Commissioner, that the juvenile cases, as you know, juvenile court, even during COVID, they were having hearings every day. They were doing them all in a video format. So we kept youth moving during that time period. That just didn't occur within the adult court system.
I'll come back to you with a couple on that, but it seems that if that's the case, that this last year's numbers might be a one-off. If the pandemic is concluded, we might see something that's more in line with what we've seen before. We don't know, but what I'm saying is there weren't kids in school, which was a lot of the kids that were going into the system were brought from our schools. And so pandemic has possibly an impact on the numbers here. We're looking at today's number of 55, and I'm not sure that that's a lot different than the average daily population last year, but these are pandemic numbers, not pre-pandemic numbers, and it might be good to see these numbers in 6 or 12 months. The adult kids' average length of stay charged with adult crimes is way, way up, 165.8 days. And this is of concern because...
Time.
I'll come back to you.
Commissioner Mike Brand.
Thank you, Madam Chair. And Kim, again, thanks for the report. It's always good information. You had mentioned earlier when you were going through it, the reentry rates and that the data reports show success in those areas, and that's good. You did allude to the spikes in violent crime, and we've all been here and we've all been seeing it. It made me think about this. The DCYC admissions over time have been decreasing. The numbers have been decreasing. The DCYC admissions by court type, those numbers are also decreasing, which is a testament to programmatic success and a lot of other things that are actually occurring, and also state law that was changed at a certain period of time, right? And we've talked about that too, but do we have numbers or reports, and I could take this offline with you, we could talk about it later too, do we have numbers and reports like some of this for juvenile and as they relate to juvenile adults that are specific crime statistics? So FBI crime statistics that show over a certain period of time as we've evolved, right, from 2007, which is what the numbers indicate on one of the reports there, until now. What do those crime statistics look like as we've evolved, as our programs have been implemented and stuff like that? So I guess I technically haven't seen a report. I know they're out there, And I know you're probably putting that stuff together, but maybe we could talk about that offline and just correlate some of that stuff with the things, with the progress that we're making and the direction that we're going, right?
And I agree, and that's why for the past 90 days, we've worked very closely with the Omaha Police Department, and they're in the process of getting us those type of reports. Let's talk about youth at a certain age.
Right.
How many arrests? What have those arrests been for? Are they felonies or misdemeanors? Things like that, so that you can start really looking at that pipeline and say, how many arrested? What happened to them at that time period? Where did they end up going? How many got into detention?
Right.
So going to Commissioner Kavanaugh's questions too, where did that disproportionality happen? Did it happen in that upfront arrest? Or did it happen at some other system point? That's what we're trying to gather, each of those main system point data.
Okay. Thanks.
So it's coming, Commissioner.
Yep, thank you.
Thank you. Commissioner Chris Rogers.
Thank you, Madam Chair. I just want to comment on the point that was made about it was alluded to that the numbers being down may be alluded to the pandemic. I don't think that's the case. Point was made the last time that this presentation was made in that respect, and it was stated then that that number trend did not have anything to do with that. If anything, the pandemic hindered us from having the numbers down more because adult court stopped. And right now, if you look at the statistics that are there, the adult court time of processing and getting through went up somewhere like 40 days. So the case is not the pandemic skewing the numbers. Actually, the pandemic put us on point where we would have had less kids in there because you wouldn't have been able to rotate them through sooner. If you look at page 9, and I think it was alluded to last time Dr. Carball came before us, page 9 from the 2019 to the 2021 piece is the most notable point in there is the passage of the law that did not allow a kid to be detained just because they did not have an alternative service, which caused us to step up in that realm. That's a distinctive dip there. And so I think that's what you alluded to and other surrounding program implementations. I think you give a little bit of that to the behavioral health initiative and the speed at which those kids have been able to come out and those alternatives. COVID was not a skewing of that down. COVID hindered it from being lower than what it was. Thank you, Madam Chair.
Thank you. Commissioner Kavanaugh.
Thanks. So, back to what we were talking about in terms of the average length of stay going way, way up for kids in adult court. And going to that page 9, during the 2015 to 2021 time period, there's virtually no change in the adult court population. But during the 2019 to 2020, there's a massive change in the juvenile court population. It would help if we could break this out, as we have in previous reports. You might see, going back to when the reports came from Brad Alexander, the types of charges that kids are being held on. A graph like that, which has been in previous reports, would give us an idea, did this change in the law make a difference? Or was it the pandemic that affected everything else in our society that could have had an impact on our youth center population? But it certainly didn't impact the adult court, which Commissioner Rogers points out, suspended hearings for some period of time. So it should have had more of an impact there. Did not at all, or very little. The problem arises when we go up to 165, almost 166 days for kids in adult court, and we're going to transfer to cells in the kids' jail that have no windows, have no natural light, and we don't have any way to get them outside like we do at the youth center. There's no gym. There's no place for them to really exercise. And so we're going to be forcing these kids to spend a longer period of time in a more confined setting. This is going to have a traumatic impact on children. If you put any of our kids in a room the size that's being designed at the kids' jail for 165.8 days, bad things will happen. You don't have to be a prophet to see that we are designing a facility that Jail Standards has issues with and has not given approval for yet, that is going to have a traumatic impact on kids that are spending 165 plus days in an unnatural setting with no place to go outside and play, no gym to do adequate exercises. I think that the exercise room has a ceiling of like 9 feet. If you go to the youth center, it's got a ceiling of, I don't know, 25 or 30 feet and a double court. That doesn't exist in the kids' jail that's being constructed across the street. So we are entering a phase that we're going to really, really have to figure out how not to have as bad an impact as I can see having on these kids, going from a setting where they do have adequate recreational facilities and natural light to a setting where neither one of those things exists. And one possible way to do this would be to segregate the populations between the kids charged with adult crimes who are going to be there for 165.8 days or some long period of time from the kids facing juvenile court adjudication, which are going to be there a much shorter period of time. And I agree with you, these programs are good for that population. They have virtually no effect on kids who are in the district court, adult court population. That's not going to affect their stay awaiting trial on felony charges. And so, you know, when we're looking at these things, and I appreciate your statistics here, because you're kind of like, as I've said, the canary in the coal mine. You have no impact on who comes to our doors. We're just reporting on how we treat them once they are. These children, these two populations of children are radically different and should spend time in appropriate settings. And the time for kids who are doing 165.8 days behind bars is not a setting down here in a kids' jail cell block where they can't go outside and they can't get adequate exercise. Bad things will happen to those children if we do that to them. And the overwhelming percentage of those children appear to be children of color. So we are intentionally constructing a facility that will have the worst possible traumatic impact on the children of color in our criminal justice system that can be had. I just want to put that on the record so that everybody knows what's going on here, because these statistics are chilling when you go over and you see the size of the cell with no natural light that these children are going to be locked up in.
Commissioner Morgan.
Kim, I want to thank you for the outstanding job you've done, and I'm not sure if it's 2 years or how long it's been. It probably seems like 10 to you, but I think it's
a year and a half, okay?
That's about it. I really do thank you for what you've done and the improvements that we've seen. The other thing I've said before at this board is it's so important for us to be respectful. I think to call it a kids' jail, as I've said before, is disrespectful. It's a youth center, and I think that's important, and I stand to be corrected by you if I'm saying it incorrectly, but I think it would help not to call it a kids' jail. It is a youth center. The other thing I want to correct, unless it's changed, and you can probably answer it for me, and I stand to be corrected, but they do not go outside at the present youth center. That's what I was told, and I've been there a number of times and been there with parents. Is that still correct?
That's still correct, and a couple of other things going to where you're going. The new facility does have a gym on the top floor. It also has an outdoor area on the top floor that youth can use. On each of the pods, there are 4 pods in the new facility. There are also exercise rooms that are 9 feet tall. So it's not basketball height, but there is a gym on the very top. Yes, the gym in our current facility is also a huge gym. It was built in the 50s. It's still there. So, but right, they do not go outside.
And I've been to the gym. I was going to go there with what we have at the new one. But there's a lot of continuous misinformation that goes out, and I appreciate that you give us accurate information. And again, I thank you for your service to the people of Douglas County. the last thing I wanted to say is if there's something we can do to make sure, and I'm not sure we can do this because of the parent involvement, but if we can help them get vaccines, some of the youth that go there, that might be a good thing for us to work on. But again, I know that maybe the parents have to be consulted about that or whatever. But I thought about that earlier when the doctor was here from the health department, is something we want to work on when they talked about the vans being out. So thank you.
And Commissioner, just to respond to that, so about 6 weeks ago, the Douglas County Youth Center did start, and they still do, reach out to every parent of every youth in there with a form and talking to them about getting a vaccine for their child. And while their youth is there, we will gladly take care of doing the vaccine. Some parents take advantage of it, some don't. We can't do it unless the parent signs a release, and the courts can't order it. But if the family is willing to, we are doing it. But we are at least reaching out to the family and saying, we have this available. Do you want to?
Great. Thank you for that clarification.
Okay. First of all, I want for the record that the statements that were made about the new facility are not true. That's a whole lot of misinformation and some outright lies, and I want that on the record. It's getting about as old as we're hearing that the election was rigged, about on and on and on and on about these mistruths, and it just needs to stop because it's not helping anything. But Kim, can you tell me what programs that we can be used or can be used to help? And this is with Commissioner Boyle, he continually talks about kids are not being able to make their, can you turn the light on, please? Make the probation, they get in there because they're violating probation, and we've made good strides on that, but maybe take a look at other programs as to why they're violating their probation and what programs we could do or have or create to help them not fail probation. He would be interested in that conversation.
Commissioner, if I could just quickly respond to that. I know state probation at the state level is now currently working with the Robert F. Kennedy Foundation, which is coming in and doing an analysis and evaluation of our state probation system as to what services are effective, not effective, and what the needs are.
Good.
Being probation is not under the county, we can't do it, but I know that the state is coming in, and we are involved in some of that so that we can bring back some information on that piece.
Okay, good. And then secondly, and this is somewhat timely, when we talk about the disproportionate minority contact, or RED, I think that we need to look outside of just, the system points are important because we don't have a good read on that, and we should, and we don't. But I think that when you go back and when Ms. LaBonne-Stennis brought in Dr. Kakar and started talking about those social determinants of health that we need to look at and how they are, how do they affect that disproportionality that we are experiencing. I think it's very timely that we start talking about that, and one of the questions that came up was about how do we measure poverty, or if we do, when children are entering our system, do we take a look at that at all? And if not, is there maybe something in that realm we should be looking at?
We really don't measure poverty, especially like coming into DCYC. A lot of the measurements for poverty that are used are free and reduced lunch.
Okay.
That if you qualify for free and reduced lunch, then you have met that percentage, and then it's considered at the poverty level. So a lot of juvenile justice data and research is based upon that.
Okay. Well, that may be something as well that we look at, and again, we want to reduce that, and we just have to figure out how to tackle it, and it's tackling it on a whole lot of levels. And then lastly, two things. The programs it would be interesting if we could look at a zip code and just take 68111, because that seems to be, if you layer everything on social determinants, on who's in our youth center, you're going to find that zip code. And so then the question is, can we take a deep dive on what programs and services are available specific in that zip code and by whom? That may be down the road, a ways, but I just think it would be important if we can focus on that zip code in some of the programs and services, which I know you did in the stability services, but maybe that net needs to be widened a little bit. And then lastly, this report to me is actually, there are successes in here. And we seem to be always pointing out negatives. And I just want to go back and, look at those charts where we have reduced the admissions into the youth center. And if you go back to 2007 and to date, you can see that. And to me, that is a huge success. I think I think everybody, and I can't imagine anybody not agreeing that the fewer kids we have in the youth center, the better. And that should be our goal, to keep them out in any way, shape, or form that we can. And we have been successful in doing that over the years, and I think we need to celebrate that. And I think we need to talk about those successes and the positives rather than continually talking about all the negatives, which I'm not trying to brush the negatives under the rug. It's just that on top of those, there are successes, and we do give hope, and there is hope for those that are still system involved, and we're trying real hard to correct that. And so with that, I do want to thank you, and I want to thank the staff of the youth center and all the system folks for the work that they do in our juvenile system. Thank you, Kim. Anyone else wanting to speak on the juvenile report?
Larry Storer, 5015 Lafayette Avenue, 68132. I too would like to thank her and her staff. I've been interested in this topic for quite a few years. I remember when there was a big push for different programs. Speaking of which, we have people that go to all these national associations, and they come back with somebody else's ideas based on what's called best practices. These best practices things for juveniles started way back when. Apparently they aren't working. Maybe that's because of human nature, outside factors. But what we need here is back and forth between the citizens and you, so we know what is false information and what is not. We expect you people to have accurate information and make accurate decisions. Yes, we all make mistakes, but to not be able to discuss it in the session like we are right now is a severe restriction to the solution of a lot of problems. Because I cannot tell what you're being honest about or not. But a citizen like me comes up here having to make assumptions, is called misinformed and a liar and sent out of the room. That's wrong, you gotta change it. We'd like to know what the falsities about the youth center is. Can we not have a printout of that or something? Can we not discuss it? Yes, I know your rules say, well, if I'm invited to discuss it, I can. But I don't know any one time in 4 years or so that any one of you or on the city council have ever invited a citizen that disagreed with them to discuss it. Lots of other people that back your programs do get to. You got to change these rules for the best, to serve the people that hired you, that pay your salary. The citizen that has a perfect right to petition his government. Thank you.
Anyone else wishing to speak during this agenda item? Okay, thank you. We have no other points under our agenda items under our committees. Just the reports as presented under Human Resources. We do have need for an executive session for litigation, labor, personnel, and legal advice. I would ask for a motion. Got a lot
Motion.
of- Motion by Commissioner Rogers, second by Commissioner Friend. Please vote. Oh. I thought I heard his voice.
Recording stopped. Commissioner Rogers, Kavanaugh, and Morgan. All right, motion passes 6-0. Commissioner Kavanaugh?
Yes.
Commissioner Morgan? Commissioner Rogers? Commissioner Friend?
Yes.
Is Commissioner Green Boyle in there?
Right there.
Oh, I'm sorry, Commissioner Boyle. And Madam Chair? Yes. Motion passes 6-0. We are adjourned at 1:21 PM.
Thanks, Dan.